I think we have a very packed agenda today, so we will start on time to make sure all speakers, there's time for everyone. So good morning, everyone. It's really, really wonderful to see you all here in person. And on behalf of the Schools for Health Partnership, I'd really like to welcome you to this policy seminar on innovating health and education for more holistic approaches to school, to health in schools. Again, it's really wonderful that so many of you have been able to make it in person, and while we know that many more of you are also following this online. Now, Schools for Health is an initiative that is being funded under the co-funded by the EU Public Health Programme to support the Commission's work in the area of health. There's another big conference taking place today, for example, on the Europe Beating Cancer Plan, where one of our colleagues is also presenting on Schools for Health, because it is, of course, school settings are so important in order to enable kids and encourage kids to build healthy habits that will benefit them throughout their lives. Yet we also know that schools' core business is not to support health. Their role is to educate children and to enable them to reach their full potential and prepare them for this fast-changing and increasingly insecure world. But we also know that if children and youth and school staff aren't physically and emotionally and mentally well, they don't perform well. So this is why health and education really go hand in hand, and we need to find better ways to integrate health in school settings. Now, at EuroHealthNet, taking such a holistic approach is really at the heart of our work, as we focus on addressing the underlying causes of health, rather than just treating the symptoms of ill health. And we aim to demonstrate how investing in health and well-being and greater health equity benefits all sectors, organizations, and actors. So that's why, and especially in school settings that are really so fundamental and foundational to our societies. So that's why we as EuroHealthNet are leading on this initiative with so many wonderful partners that are with us today. As you've seen from the agenda, we also have a wonderful lineup of speakers today with a great deal of expertise collectively on this topic, who can shed light on it from a wide range of perspectives, so that we can really see what we can do to promote, to advance this health promoting in school agenda, this holistic approach, and to strengthen the uptake of this across Europe. Unfortunately, our facilities here don't allow us to interact with our online audience, because I think we had quite a few sign up, but we do encourage everyone online to react by the Twitter feed and to get in touch with us after the conference if you have any questions that we can also take to the presenters. We are also very pleased that this policy seminar is taking place under the auspices of the Belgian presidency of the Council of the EU. And one of the 6 priorities of the Belgian presidency is reinforcing the social and the health agenda by, for example, building on the European Pillar of Social Rights. So we're sure that the discussions and the learning here can contribute to this priority. We're delighted that Hilde Krevits, who's the Flemish Minister for Welfare, Public Health and Family, has provided us with a video message to reflect the Belgian presidency's support. And let's turn to her message now.
Hallo allemaal, dag beste aanwezigen. Spijtig genoeg kan ik niet aanwezig zijn, maar ben toch blij om jullie op deze manier even te kunnen toespreken over dit belangrijke onderwerp. Als Vlaams minister van Welzijn, Volksgezondheid en Gezin ondersteun ik uiteraard ten volle de organisatie van deze Schools for Health seminar. Kinderen en jongeren die zich fysiek, sociaal en mentaal goed voelen, kennen doorgaans een vlottere schoolloopbaan en hebben meer kans om uit te groeien tot burgers die zich ten volle kunnen ontplooien. We hebben er dan ook alle belang bij om daar maximaal op in te zetten. Hier in Vlaanderen doen we dat onder andere door de uitwerking van een sterk preventief gezondheidsbeleid binnen onderwijs. Onze scholen zijn bij uitstek de ideale plaats om hier aan te werken. Want van daaruit kunnen we in principe alle jongeren en kinderen bereiken. Ook zij die zich in een kwetsbare situatie bevinden. Met onze Vlaamse gezondheidsdoelstelling geven we richting aan dat beleid. Ook specifiek binnen de setting onderwijs hebben we een concreet doel vooropgesteld. Tegen 2025 willen we een voldoende kwaliteitsvol preventief gezondheidsbeleid uitwerken in 80% van de basisscholen en de secundaire scholen. We zetten daar eigenlijk voor in op een aantal sporen. Data- en kennisgestuurd werken staat daarbij voorop. En daarvoor gebruiken we onder meer de preventiepeilingen en de HSBC-studie. Zo blijkt uit de resultaten van de laatste studie van 2023 dat het mentaal welbevinden van jongeren enorm onder druk staat. Daarom maakte ik eind vorig jaar nog €400.000 vrij om jongeren, voornamelijk in het beroeps- en buitengewoon secundair onderwijs, via een soort schoolinterventie te ondersteunen om veerkrachtiger in het leven te staan. Daarnaast ben ik ook heel trots op ons uniek aanbod van public health binnen het preventiebeleid. Voor kinderen van 0 tot 2,5 jaar hebben we over heel Vlaanderen een aantal consultatiebureaus van kind en gezin. En aansluitend hebben we de Centra voor Leerlingenbegeleiding, of kortweg CLB's, voor schoolgaande kinderen en jongeren. Een CLB ziet elk kind van 3, 6, 9, 11 en 14 jaar om de ontwikkeling op te volgen. Zowel op lichamelijk, op geestelijk maar ook op socio-emotioneel vlak. Op die manier houden we de vinger aan de pols en kan er snel ingegrepen worden waar nodig. Beste mensen, tijdens het Belgische voorzitterschap van de Raad van de Europese Unie zal ook Vlaanderen meewerken aan de belangrijke lopende dossiers die de sociale en gezondheidsagenda van de Unie versterken. Het gaat onder meer over de zeer belangrijke onderhandelingen rond pandemische paraatheid of ook de European Health Data Space, een prioritair dossier van de Vlaamse regering dat nog maar eens het belang van data in de zorg benadrukt. België zal met zijn voorzitterschap een sterk signaal sturen naar de nieuwe Europese Commissie om verder te investeren in gezondheid en zorg voor kinderen, jongeren en alle burgers. Beste mensen, u hoort het. Er is momenteel heel wat in beweging en ik maak me sterk dat we onze doelstellingen kunnen halen. Maar dat kan alleen als we goed blijven samenwerken en van elkaar blijven leren. Europees en internationaal samenwerken is al heel vaak succesvol gebleken voor Vlaanderen. Ik hoop dan ook dat dit seminarie en de contacten die hier vandaag gelegd worden nog meer inspiratie mogen bieden om dat in de toekomst dus te blijven doen. En dat we zo kinderen en jongeren over heel Europa alle kansen mogen blijven bieden. Dankjewel voor jullie aandacht en alle succes voor de toekomst.
I think it's very encouraging that the Flemish Minister of Health is making the link between the well-being, health and well-being of children and youth and their academic success. And she also makes a very important point of how schools are settings that really reach all children and youth, including the most vulnerable. And she outlined a number of initiatives that are taking place here in Belgium. And I know that amongst us, we have quite a few people representing organizations in Flanders, from Flanders or Belgium. So we do invite you to share more about these initiatives when there's the opportunity. And I particularly underline her final point that let's really use this opportunity that we have here today amongst ourselves to network, to learn from each other, and above all, to see how we can really collaborate, again, to strengthen the uptake of health promoting schools across Europe and the whole school approach. We should note that the Belgian presidency is building on the work of the Spanish Council presidency, that also placed a very strong emphasis on the well-being of children and youth during their presidency. They, for example, issued council conclusions on the mental health of young people, and also a declaration on school meals as a way to address food insecurity amongst children and young people. And they organized a conference on the theme of childhood obesity with a view to try to take more action in this area too across Europe, maybe revitalize a plan. We are therefore very pleased to have representatives of both the Ministry of Health and Education from Spain amongst us today, and we'll be from the National Ministry also, and we'll be hearing from them in the next session, in the next panel session. So now, with no further ado, I'd like to introduce our keynote speaker, Dr. Kevin Dadazinski, who will present to us on the value of investing in health-promoting school approaches. Kevin is professor in health information and communication at the Fulda University of Applied Sciences, and amongst his other affiliations, he's a member of the German study group on the health behavior of school-age children. He's School-Age Children Network. He's coordinator of the Global Health Literacy Research Network. And last but not least, he's co-chair of the research group of the Schools for Health Europe network. So Kevin, the floor is yours.
So good morning, everybody. Thanks very much for the introduction. It's great to be with you this morning. I have been asked to give a presentation about the value of health promotion in schools. And I would not like to talk about the value of health promotion for health. I think it's obvious you're quite all expert in health. But what I would like to do rather is to think a little bit more about the value of health promotion for education, because you're acting in systems that are primarily legitimized by an educational responsibility. So it's very good to think about the links between health and education. So talking about this, I have these 4 points that I would like to talk about. Let's focus on the first one, which raises the question, if we have an educational crisis all over Europe. And to answer this question, it's a good idea to have a starting point in a program for international student assessment, which is the PISA study that you all know, that started in 2003 and then went on regularly, and the last results have been published last year in 2023, and it resulted in huge political discussions. What about our educational systems? And the results can be found here on it's here. I hope you can see that here on the right side. And if you follow the results, these are the average test scores for mathematics, reading, and science for 2003 until 2023. And if you draw a line, you will see a declining line. So there's a declining tendency towards the scores, the test score that are achieved in these 3 subjects. If you take these 2 last wave, 2018 and 2023, you see a very substantial drop, especially for mathematics and reading, that goes up to minus 16 points. So you see, obviously, there's a kind of achievement crisis. And this achievement crisis forced some magazines like the Signal Brussels to say the kids are not all right. I wouldn't claim it like this. It's nothing about the kids. It's maybe more about the educational systems, not about the kids. But another problem that goes hand in hand might come along with teacher shortages. So in more than 30 educational systems in Europe, we have teacher shortages, especially for secondary school. And here are some forecasts for Germany and Portugal. By 2030 and by 2035, we will have a teacher shortage of 30,000 up to 70,000 teachers. So you might question whether the teaching occupation is not attractive enough for teachers to become teachers. And there are a lot of arguments why this might be the case. You see it here on the left side, a map. And the darker the color gets, the higher is the proportion of those who are 50 years or older. So we have an educational system which a high average age all over Europe, especially in Portugal, Italy, Hungary, and Estonia, etc., some other countries as well. If you look at the salary, there are some countries with low salary on the teaching occupations. This is not true for all countries, but for some countries. But what we have as a common denominator in all European countries, that teachers report a high proportion of teacher stress. And if you ask them what kind of teacher stress they perceive, they will mainly come up with administrative work. So not the teaching itself, they're the main part of the teaching occupation. This is not stressful to them, but maybe more the administrative work, the things around the teaching, which stresses teachers. Let's now focus a little bit more on health. When you would like to know whether health is on top of the political agenda in European countries, there are not many studies that give you an insight about that. But there's one study that has done by my dear colleague Teresa Villace and other colleagues from the Schools for Health in Europe network, and they have asked the national coordinators of the single countries who are part of the Schools for Health in Europe network. So each national coordinator represents one country, you could say it like that. And I would like to draw your attention to these two parts here. Where you see that in more than 2/3 of the countries who were surveyed here, they have a national policy that require the schools to have health education as part of the curriculum. But if you go down to the lower part of the slide, you see that there are 30%, 30% of policies available that require the schools to implement a broader, a holistic approach of school health promotion that we call health promoting schools. So you might question, why is this the case? And maybe we can have a first thought about that they perceive health as a zero-sum game. What is a zero-sum game? When you ask schools, are you interested to become health promoting schools? They would always say health is important. But anyway, they often perceive health supplants time that is needed for the core subjects like reading, math, and the things that I showed you at the beginning of the presentation. So health is not a mandatory part of the policy, and this is perceived as they would have another responsibility, and the responsibility is not health, the responsibility is education. And I think based on the education crisis I was talking about at the beginning, I think this concern is expected to increase in recent years when we do not advocate for health as part of an education policy. But I think you should not separate health from education. I think health is part of the solution of the health crisis. It's not something that is kind of an extra burden that you put on schools. And to give you an example, in 2011, 12 years back, WHO Europe has commissioned Sorka and Pasnives to come up with a kind of model to figure a little bit out what the relationship between health and education really is. And they suggested here on the left side, child and adolescent health indicators, and here on the right side, short, mid, and long-term educational outcomes. And what they said was there might be a kind of direct relationship, but most presumably there might be mediators that are between this relationship between health and education. For example, self-esteem, teacher-student relationship. And they also proposed that there are a number of factors that have an effect on the strength of the relationship between health and education. First and foremost, this could be the socioeconomic background that we know is important for health, but also determines educational attainment. So it might be an important factor that contributes to relationship. But let's assume if you control for all these factors, there might be still a relationship between health and education. And when we assume that, then we can go further and say educational attainment in late adolescence or early adulthood might determine later outcomes. This is very well known from empirical research. It has an impact, for example, on the abilities to have a good position with high income, etc. This will have an effect on the health status. And the authors conclude when you have good adult outcomes, this positively influences the next generation's outcome, so the children of the children. So, and by highlighting this, the whole model becomes a little like an intergenerational model. So in sum, there is a relationship between health and education, but to put it a little bit more concrete, what we've done in recent years is to look a little bit more into the relationship between health and education. So we see here again, short, mid, and long-term educational outcomes. These are just some examples, grade point average, test results, subjective competence, etc. And here on the left side, you see some health indicators. Overweight, physical activity, mental health outcomes. And we started in 2012, we looked at this relationship, and we found that all of these indicators can have some sort of relationship with education. And when I talk about the relationship, I'm talking about the longitudinal relationship that health predicts education. So health as a determinant of education. You see here, the thicker the arrow is, the more pronounced, the more strong the relationship is. And you see here on the left side some stars. And the more stars you see, the better the evidence base is. Let's take an example. Here, physical activity. We have found very strong evidence that physical activity over the long term and also over the short term predicts educational outcomes here on short, mid-term, and even long-term levels. But as you see it here in the middle, it's not that we have this very simple, easy, direct relationship. There are a couple of factors that are here in the middle that we need to take into consideration. First and foremost, as already said, this is the socioeconomic background, the socioeconomic status that has an impact of the strength of this relationship. For example, what you cannot say is that overweight will result in lower test scores, for example, but we know that overweight will have an impact on mental health problems, and that these mental health problems in turn might have a detrimental effect on education. So this is well known. Although we do not know everything, there is evidence out there. And again, it shows us health is a friend of education. It's a resource that helps us to have an education equality and achievement. So when we accept this, then we would think about the approaches. There are so many approaches on school health promotion out there, but we brought it down a little bit to two approaches that Peter Paulus, who is here in the audience, and I proposed. One approach is the behavioral approach. The behavioral approach of school health promotion takes its starting point in a certain problem. Let's say physical inactivity, mental health problems, whatever, take whatever you want. And the idea is to address a single target group within the schools. Let's say you address pupils of the 5th grade, of the 7th grade, whatever. And the main idea is to go inside the school to address the target group. So the school is just a place where you can find your target group. So the school itself will be not part of the intervention. It's more an idea to get to the target group. And the basic idea is to change individual level determinants of health, behavior, attitudes, knowledge, etc. On the other hand side, we have the health promoting school. The health promoting school is much more complex because it goes way beyond individual level determinants of health. So it's also about the social environment of the schools, also about the structural environment, the physical environment of the school. And the basic idea is that you do not only focus on one target group within the school, but on different target groups. So on teachers, it's on pupils, it's about family, it's on non-teaching stuff. So everyone who's involved in and outside the school is part of a health promoting school. And the basic idea is that you enable schools to become the driver of their own change. This is totally different from this one. Here, an expert would, for example, go to schools and would deliver a program, then he will leave the school, and very often, it's not surprising, the effects disappear in a way. That's not always the case. I'm a little bit exacerbating here. But this is the difference, and we call this one health promotion in schools, because you could just go in schools, and the other one is called the health promoting school approach. And you see, I'm much in favor of this approach, of the health promoting school, because it has a high potential to have for sustainable effects. This is just an example. I will skip this because Martin Weber will talk about that a little bit later. This is how WHO thinks about the health promoting school approach. There are different approaches, and this is one that I think Martin will introduce later on. What I would like to talk about now, this would be the final slides, is about to talk a little bit about sustainability. And there's one review out that came from Hallett and colleagues, and when you could focus your attention a little bit on this last sentence here. The review says no discernible relationship was found between evidence of effectiveness and sustainability. So in other words, you might have a very well-developed behavioral program. It could result in good effects because it's more easy to be evaluated, but it says nothing about the sustainability. When you would come into the school 2 years later, maybe the program didn't exist anymore. The other way around, if you have a health promoting schools, much more complicated to be evaluated. It might not result in immediate effects, but it's more sustainable. So effectiveness and sustainability does not necessarily go hand in hand, but of course it would be good to go hand in hand. So, but they came up with key facilitators and key barriers of sustainability. Key facilitators, for example, were leader commitment, leader support from the school principal, for example. Observation of positive impacts. When you see that there's going on something positive and that has an immediate positive change or a positive effect, then you're more committed towards the health promoting school approach, and then you will invest your time in this. If you're confident in your own abilities to deliver activities on school health promotion, then you will do it. This is more about training here. And this is more about the attitude. When you believe in the value of health promotion, even when it comes to education outcomes, then you will do it, of course. And in the barrier would exactly the opposite. When you focus too much on education outcomes and you don't see the relationship with health, then this would be maybe a barrier to do something. So I would like to end up a little bit with data from own research that we have done before the COVID pandemic with school principals in Germany, almost 5,000. And we asked them to think about if health promotion would result in educational benefits. And then we grouped that into a group with higher, who think that the education benefits are high, versus those who think the education benefits are low. And what you see here is the proportion of implementation of the health promoting school. So we see that those who think there's a high educational benefit from health promotion, they also report a higher implementation status of the health promoting school in their school. And the difference between the two groups is 15%. So really substantial, as you see it here. We also see a difference in decision latitude and resource availability, also always with the same idea. Higher decision latitude leads to higher implementation, higher resource availability as perceived by those principals leads to higher implementation. We also put it in more elaborated models. This is more easy, but we find exactly the same. So it stays stable, this kind of effect. Okay, let me summarize. 4 points I would like to give you as takeaway. We have a kind of a sort of educational crisis. We have a crisis of achievement, at least, and we have a crisis of attractiveness. So we need to understand that health is part of the solution. It's not something that goes as an extra burden on the shoulders of the schools. It's part of the solution. It's very important to advocate for that. Secondly, I showed you a little bit that health and education, there are clear links. But although this is clear now, empirically clear evidence for that, we don't see that much school policies that require schools to do more holistic approaches on schools promotion. We need to advocate for school policies. Third, I told you a little bit about the health promoting school approach. It's a very complex approach, which means that you cannot do it the same way. It's not a one-size-fits-all strategy that fits for all schools. You need to treat every school as a single school with their own needs, with their own wishes, and with their own developmental roots. It's a little bit more complex, but it's good to focus on that because we know it's more sustainable. And finally, we often think about topics. We often think about the what dimension, what needs to be done, but we do not think that much about how things need to be done. This would be more about implementation. We should think about how can we enable schools to take their own change with regard to health promoting school. So I would advocate for thinking about how and what, not only about the what dimension. Thank you very much.
Thanks so much, Kevin, for laying out the foundation so well. I think that really sets us up for a lot of great discussions later on today, and also sets all the speakers up with the fundamentals of what health promoting school really is. And lots of, I think, we're really thinking today about the how, but also one of the things I got is the what. We really have to demonstrate the benefits of this to school principals and then look at the how. So that's, again, lays out for us what our focus really is. As chair, I really face a dilemma because I'm sure there are lots of questions out there or comments, and we could have a great discussion on the basis of what you just presented, but it's exactly time to move into the next session. Okay. Kevin will be here all day with us, and we do have, and also in the workshops and things where we will have more time for discussion also. So hold your questions, and we'll keep them for somewhere else. Find time with them for them in the program today too. But with that, I think we will move into the next session on setting the scene. And this will be chaired by Hof Buys. Hof Buys is a valued member of our steering committee. They're all valued members, but Hof, especially since he has so much experience in this topic of health promoting schools and whole school approaches, because he was the manager of the School for Health in Europe network up until, for 10 years, I think up until 2018. And since then, he is the manager of the UNESCO Chair of Global Health and Education and of the WHO Collaborating Center for Research in these areas, together with Professor Didier Jourdan. So both the chair literally is yours. Maybe it's easier to sit there.
Good morning, everyone. I'm happy to be here and to be part of the Schools for Health project. I think it's a really interesting initiative led by a fantastic organization, EuroHealthNet, and a great team of partners. And the seminar, I think it's crucial in the project, but also in the next step in how we can bring health promoting schools a step further. I'm very happy to chair this session. It's extremely concise, 6 speakers in 1 hour. We will stop at 11, no matter what. That's my guarantee. And I'm very happy to introduce to you the first speaker, who is Philippe Roux. I know Philippe actually for quite a long time. And yes, I do. Ah, come on, it's okay. It's okay. And Philippe is now working, he's acting director of the Public Health, Cancer and Health Security Directorate at DG Santé, Directorate General Santé at the European Commission. And he has a very interesting career from the French social sector up to European sector in various ways. And you will be presenting the European perspective. Philippe, the floor is yours.
Well, thank you very much, and sorry for indeed being a bit old, especially when we're talking about health promoting schools. So I'm certainly not the best example. But having said that, I liked very much what my predecessors mentioned about the how as an important element, because effectively very often we think of what, but it blocks at the how. And I think to think both and to start by thinking how is very essential. So I took already a bit of my time, but I tried to be short. But I saw that was important because if there is one take-home message for all of us, I mean, this is one also for me. And it's nevertheless a pleasure for me to be here. I mean, you mentioned it, it's a presidency, Belgian presidency event. And I do believe that schools are playing an important role in the educational, physical, mental, and social development of our children. And I think these 3 elements are very complementary, and I would not separate that. And this is why also one of my predecessors' statement was about ensuring that we don't take health as an extra burden in the curricula, but as simply part of it, because that's an essential element. And that is part of making a success. So if I know how to handle that, because being old makes you don't know how to use these things, yes. So what I will try to do rapidly is to cover just a couple, and in fact 5 of the initiatives that may have an interest to you and an interest in the activities we have with children. The first is the European Beating Cancer Plan, because I actually continue to be the head of unit of that. That's the pleasure of being an acting director. So you have 2 roles, so that's just great. But it's an exciting one, and I think the Beating Cancer Plan is really a great initiative. I want to also to touch the Healthier Together initiative, focusing on non-communicable diseases. The comprehensive approach to mental health, I think, also an important element, in particular when we're talking of children. And about the how, to talk about both the EU best practice portal and the EU for Health program. So a lot in a way. No, I was successful once. Yes, it needs to be strong. So the first is the European Beating Cancer Plan. I wanted to mention it because first, the way it was built is interesting because it's integrated and health in all policy approach that was conceived here when we built this plan. We wanted indeed to cover the entire path from the prevention, early detection, diagnosis and treatment, but also quality of life of cancer patients and survivors, which is often forgotten. So here, and important to mention, I mean, children are a central part of the activities that have been foreseen in the plan. So the cancer for children is seen as very important. And we have a number of cutting themes also, and research and innovation is one, digital and personalized medicine, and all of what we're doing here, and I think it's important to mention it, is to reduce inequalities, because that's also for school an issue. The reduction of inequalities should be among our main objective. And as I said, we are doing in this plan a special focus to address childhood cancer. So what was interesting also to mention, and that perhaps it's an interesting lesson, because often it is we think that it's impossible to cooperate, and that's very true also in the Commission. It was seen as very difficult to cooperate across the different DGs, and we proved that we could do it. And for instance, there is a co-governance of the cancer plan and the research missions on cancer. So I have the honor to co-chair the mission on cancer. So that means that there is indeed a possibility indeed to work together, and that's also perhaps a take-home message. So we should not abandon because we think it's impossible to cooperate together. The cancer plan itself encompasses 10 flagship initiatives and 32 further actions with multiple sub-actions. So it's really huge, but it's also possible in terms of the how. We have more than 4 billion to achieve, so much more than we had ever on health. I mean, for those who know the amounts we were working with, I mean, here this is serious. And help a potential activity with success. And as you mentioned before, I will not stay after the coffee break, not because I have no interest, but because we are having this important conference where we take stock of all what has been achieved the last 3 years, and that is for this afternoon. So, but I wanted to be here nevertheless. So I 2 minutes left. So well, give me 1 minute more because that really doesn't work. But the next one is the Healthier Together initiative I wanted to mention, and why I wanted to mention it. It's because it supports the member states in reducing the burden of non-communicable diseases. And it's also the result of a co-creation process and between the Commission, the member states and the stakeholders. And I think also that's an important element. The key objectives are to increase EU support in a coordinated way. We focus on the major health burden areas, And we also target national needs in key disease area. So, and again, it also aims to reduce inequality. So all these initiatives are the same. And we have 5 strands in here where we have a strong focus in diabetes, cardiovascular diseases, chronic respiratory diseases, mental health and neurological disorder, and health determinants. So now all these are supported by the EU for Health plan. So very important. Well, you do it better than me. I don't know where I am. Yes, mental health. Well, I don't know where I am when we're talking of mental health. Seems to be appropriate. So I think here there are a number of elements you will all understand. I think COVID pandemic, the Russian war of aggression against Ukraine, now Middle East. There are a number of subjects that we all are impacted by, and they increase the mental health problems, and especially children and young people are suffering. I mean, I myself think that during COVID, my boy turned 18 and he was locked with his father and in a house, and it's not the best for that. And I think and you don't do your 18s twice. I mean, that's a personal and simple example, but he doesn't suffer so much, but there is much more suffering on mental health. So, and I think that this new comprehensive approach at EU level, which we have developed, is really focusing on the multi-stakeholder approach to mental health, and also the communication, and I invite you to read it, because it also leads to a number of how we can do as a dedicated chapter on boosting the health of children and young people. And I will not go into the details of the flagship initiative. I count on you to go and look at bloody shit. Yes, EU Best Portal. I think what is important also is the sharing of the good practices. Time is up. Use that EU portal. I mean, it's important for you also to use it as a tool, not only to get information on initiative that works, but also to introduce the one that you are indeed using. I did press the wrong button. The red button is not the right one for the next one. And my final slide is really on the EU for Health program. I think very important tool, as I said. There is a 5.3 billion budget for 21-27 period, so a large budget. So it's for us, for you, to use it at best, because if we prove that we have been able to use it properly, then we have a chance to continue to have important financial support. So cooperation, it has been said, it will be said all along. We are working with the member states authorities. We try to prioritize with them and to follow what they consider important as a priority. And that's for me very important, because it is not anymore the Commission on its own deciding, but it's a co-decision with the member states, very important. And here again, I do believe that schools are key partners for the member states and also for the Commission. So there are 3 areas where I see, and I wanted to mention them. Vaccination and immunization is one area where I think a school can play a role. The health determinants, so helping that, ensuring that tobacco and nicotine addiction and the pressure to drink alcohol are fought decisively from the start. And I think here in school, I mean, we can play an important role. And also, last but not least, and I'll finish on that word, mental health. I think here there is a key role in schools to detect and help ensuring that we preserve the mental health of our children. Thank you very much. And I'm sorry I've been a bit longer. But...
Thank you very much, Philippe. And actually, you were very well in time. So great. And thank you for stressing that you say that's possible to work together. I mean, you demonstrated in the work that you do, and also that you from DG Santé see school as a key partner I think that's great. And it's a nice step to the next presentation, which is from DG Education. And it's will be done by Oana Felechan. I hope I pronounce your name right. And you are policy officer on school education, equity and well-being at the DG of Education, Youth, Sport and Culture at the European Commission. So without further ado, please, the floor is yours. And remember, if you have any questions, you know, I can imagine that what you heard from Philippe Roux might cause raise a few questions. It will be the same, hopefully, with the other speakers. Please save them, because there will be 10 minutes left, we hope, for some kind of interaction. Okay. In the meantime, Juana, the floor is yours.
So thank you very much. I'm really super happy to be here because it's we speak a lot about cooperation, how to build the links, what is the role of school, how to deal with health. As we will see, we speak about more about well-being at school, but it is really the same concept. So yes, I think I'm really thrilled to be here and to see how after we can take this networking and working together even further. Now, what I will explain in the next 8 minutes, it's how we work. So we work on general education until the end of from primary until the end of upper secondary education. And the attention we put to school success for all learners and how well-being, social-emotional learning, health-related aspects fit into this picture. The bigger, how should I say, strategic framework we are working in, it's called the European Education Area, which is about building a genuine space where education is interconnected among the systems and where mobility will become an integral part. So studying abroad will become an integral part of the of one learner's trajectory and also for the teachers. But also a system where high quality education is in place. Within this strategic framework, there are several building blocks, and I will be speaking about Pathways to School Success initiative, which is in practice, it's a okay, if you can, yes, which is a council recommendation. I'm not sure how many of you are familiar with the council recommendation. Yes, so it's member state adopt a legal text without any formal obligation. However, they engage to work together towards achieving common goals. The Council recommendation on Pathways to School Success, it's a quite recent one. It was adopted in November 2022, and it built on years of cooperation with member states, but first it stemmed from policies on reducing early school leaving. You might know that at the European level, we used to have a target of an average of 10% of early school leaver, which on average it was reached. Now we try to go beyond below 9%. However, in some countries, the early school leaving remains quite high. On top of these challenges, what we saw, and the predecessor via the keynote really very well explained the challenges. Indeed, we are going through an education crisis. We've seen this with PISA 2018, and we are seeing it now with the latest results. Achievement in school, so basic skill really deteriorated. So it was not only it was the moment where we started to work on a more integrated approach. It does not make sense to keep children in school if they don't perform well. So in addition to addressing early school leaving, we also need to look at underachievement. And on top of this, the 2018 PISA results showed very well. Unfortunately, violence at school, bullying, and all these aspects have a huge impact on children's learning trajectory, success, and should be addressed in as the foundation, well-being as the foundation of school success. Now, in terms of definition, what does it exactly encompasses this the well-being dimension? We are using the WHO definition, so a dynamic state where children and young people realize their own abilities, learn to cope with the common stresses of life, to develop a positive sense of identity, and the ability to manage thoughts and emotions, to build social relationship, and to acquire education that fosters active citizenship. We are also using this from this perspective, it's interchangeably with positive mental health, right? And seeing well-being as physical health and mental health as fully integrated in this well-being approach, and as a condition for success, and not merely the absence of illness, right? So from this perspective, we resonate. I mean, I resonate very much with what the keynote was presenting. So the Pathways to School Success Country Recommendation aims to address these three objectives at the same time. It replaces and recalls the country recommendation on early school leaving. So we look at things more holistically. And what also PISA showed in 2028 and now even strengthened it, that those who perform so with low achievement in basic skills is very much coupled with socioeconomic status, and also with migrant children of migrant background, or with different languages at home. I can also speak about this in a moment, if we can. So the council recommendation, it's a legal text that calls for the member states to develop an integrated and comprehensive strategy for school success that addresses at the same time universal measures, but more targeted support, targeted and individualized approaches for learners in need. It is a high focus on prevention, but also with elements of intervention and compensation. When you access the country recommendation, the legal text is accompanied by a policy framework. It's annexed, which really details, and we can go to the next one. I will not enter into the detail of it, but which really details measures that member states can put in place at system level, at school level, at the level of the teachers, and then to address the learners. It is accompanied by a staff working document that you saw in my first slide, and really this is a very solid research-based handbook, we call it, that can accompany the different measures that are recommended in the pathways. I will not enter into the details of it, but just some key aspects that need to be emphasized. Here we are working with a whole school approach. The whole school approach implies two things. On one hand, when we look at a specific intervention in schools, it needs to be implemented by all teachers, by all school staff, in a collaboratory manner and based on multidisciplinarity. And here it's very important, for instance, when we spoke about social-emotional learning, it's not up to some teachers to do it. Every teacher should become a social-emotional learning. And it's up to the whole school structure, organization, by the role of the school leaders, bringing this, creating these positive school environments that help achieve this objective. Now, the whole school approach implies a second aspect, which is the stronger cooperation with external stakeholders for things that schools do not have the capacity to do. And here is the health promoting. I mean the aspect relating to health, which enter into next one. I try to hurry, but keep in mind these two aspects. And the third one, very important, it's also seeing education from the rights of the child perspective, right? With the involvement of the learners in the process. Now, at the Commission level, now we are in the full part of implementing pathways to school success. We have a working group with representative of member states that we touch upon different aspects of pathways. This year, towards the second half of the year, we will focus specifically on well-being at school. Can we pass to the next slide? Because on the whole system, you also will have an expert talking about the approach. The Commission also launched an informal expert group, which started its activity last year in March and will deliver by the end of spring this year a set of guidelines on the whole system, whole school approach to well-being. So I will not enter more into the detail of this. But at the same time, it has been coupled with some with funding. So first, from the Recovery and Resilience Facility, this also came as to response to PISA. So PISA 2018, I'm saying, out of the 73 billion, 13% it is addressed for education and skills. Now, going more in the latest one, technical support instruments here, there have been some flagships related to mental health and well-being. The first two are closed, but we have via Erasmus Plus program priorities that address well-being and mental health at school. So the first one, partnership for cooperation. This is a decentralized call. So if there are applicants potentially interested for this, please do contact the Erasmus Plus National Agency in your country. This is an annual call, so now it's 5th of March, the deadline, but if you miss it this year, you can have the possibility next year. And then there is a specific priority, European policy experimentation, addressed to Education Authority, which has a deadline 4th of June. So this is a one round, and please follow the link if you are interested to see how to apply. And I think I stop here as I see the time is.
Thank you. Thank you so much for your presentation, and very interesting to see how, from the education perspective, health and well-being are almost automatically integrated. So it's a really great example, and the pathway to school success, I think, is something that's really relevant for us. And you echoed a lot of what Kevin actually talked from when we talked about the values of health promoting schools in your presentation. So thank you very much. And yes, of course. Use the mic.
These are really some communication material we put together for schools, so just use them, and it's about the different dimensions we are looking at in pathways.
Maybe from your talk, it will generate some project proposals here. Well, lots of opportunities anyway. And now we will look at the WHO, the UN organization level. First, we have a talk by Martin Weber, my esteemed colleague from WHO European region, currently working in Athens. And I know Martin for many years. He's an advocate for child and adolescent health and also for health promoting schools. And Martin, the floor is yours.
Well, thank you very much, Rolf. So I'm the fourth one who is going to present conceptual frameworks and outlines to you. And I hope I can highlight a few of the main aspects, because otherwise we are just going to overload you. Can I have the next? How do I have to do this? Okay. Oh yeah, it works. So I thought it might be useful to give a little bit of history in the European region. Kevin has a bit alluded to it already. Many of you here in the audience actually have worked as part of this history. So health promoting schools is not a new idea. It has been around for a little bit over 30 years, and there was a European network for health promoting schools established in 1992. It went through iterations. It has some problems. We are going to discuss some of them later. There were notably 5 international conferences which put together a lot of the evidence and the experience which we had. And I think one of the most important achievements was a conference which was held in Paris in 2016, because we put it on the agenda by that time that every school in Europe should be a health promoting school. And we have been alluding to this frequently. And I think this is a very important advocacy message, which you can take to all levels. Individually, to the school principal, to your city council, or at a national or international level, to say, this is what we are working towards. Every school should be a health promoting school. The main network in this regard was the European Network of Health Promoting Schools, which was renamed about 15 years ago into the Schools for Health Network in Europe. And just to show you how it's represented in Europe on the map on the right-hand side. So it is prominent across the region, but there are some notable exceptions, particularly in the Balkans and Southeastern Europe. Countries we would like to have involved in this as well, because we believe in the benefit of exchanging experience across the network and having joint standards and approaches. Some of you might remember there was a major health outbreak about 2 years ago, which was derailing almost everything. It was called COVID-19. Still in your memory, some people seem to forget about it. And to address the effect of COVID on schools, or try to mitigate it rather, WHO brought together a technical advisory group on schooling under COVID. We wanted to balance infection control on one side. And don't get me wrong, I have a background as an infectious disease pediatrician strongly. I'm not against infection control, but we realized very early in the outbreak that some countries were totally overdoing it. And I think it was Philip who was saying that he didn't think his adolescent was doing very well by being only together with his parents, because socialization, social exchange is a developmental need of school children. And if you deprive them of this, you are really missing an opportunity. So this COVID advisory group tried to balance the whole thing, brought together 8 recommendations which were promoted in high-level meetings. And again, it was one of these achievements, I believe, to bring ministries of health and ministries of education together. And that's always a difficulty in all of the countries. I see nodding in the audience here, to make sure that we are addressing the infection control in the best possible way, have a better school environment, but at the same time, we try to strengthen the school environment overall in health promotion. And of course, it gives you an opportunity to teach children about infection control if you have an infectious disease. So we believe there was a win-win opportunity to strengthen school overall. And we must make sure nowadays that COVID is gone, that people still remember that we would like to prepare further. Let me mention another network which has been mentioned by some of the previous speakers as well. This is the Health Behaviors of School-Aged Children Network, again, an associated network with WHO, which is doing surveys every 4 years on health behaviors in this age group, 11, 13, and 15 years old. And you see it's wider disseminated in Europe than the SHE network at the moment. Some countries are doing very well to take the findings from this survey back to schools to address the problems which were found. We are at the moment busy with publishing the international report from the 21-22 survey circle. The mental health part, it's 7 volumes which are coming out over this half year. The mental health is out already. The other volumes are coming out over the next 3-4 months. So this is the international perspective across Europe, Central Asia, and North America. In addition, you have the national reports which you can build on. So we had seen a similar slide or similar survey before through the SHE network. We have the advantage in Europe that we had a European strategy on child and adolescent health, and I come back to this towards the end of my talk again, if I have enough time. And in the context of this previous strategy, we could ask member states, the 53 member states in the European region, some questions, what they did in implementation of the strategy. And one of the questions which we asked here is, do they have a strategy for health education at schools? And you can see that most of the member states answered they had it. Some of them, which you would find surprising, say they didn't have it as a national strategy. It doesn't necessarily mean they don't do anything about it. That's something for you again to go back with a finding like this and to discuss with your national government and say, why is this not happening and shouldn't we do something more about it? We had this sort of dialogue very prominently with the Netherlands, where actually quite a few of the scientists disagreed strongly with the answers which the Ministry of Health gave to this survey, and they got into a dialogue. And I think that's the opportunity when you have a questionnaire like this, you go into the detail and you drill down and you say, shouldn't we have this because our neighbor has it already? Let me move on to some of the global guidance, and I will run through this very, very quickly because we don't have enough time. The SHE network has come up with guidance for health promoting schools. There's a SHE manual in Europe, which was published originally in the 2010s and then revised towards the end of it. WHO, Euro came up with guidance for health promoting schools, and I showed you the quote from the 2016 conference, every school should be health promoting school. We were very pleased when our headquarters colleagues in Geneva took this up and worked together with UNESCO to come up with more detailed guidance. And they did very detailed evidence-based review. WHO is an evidence-based organization. So when we come up with guidelines, we have to review the literature. What is the evidence that we come up? And they did this 2 years ago, and they have come up with this global initiative with a lot of materials, which I'm going to show you in a quick run through in a minute, that to make every school a health promoting school. So that's the vision, that's the aim, and supporting countries. And there are different frameworks which are used, and I'm not going to bore you with all the detail. Suffice it to say that you are starting in the school with the school environment, school health services, physical environment, school curriculum. Again, Kevin talked a lot about it before, and then you put it into the wider environment with government policies, local policies of the local government and everything else. So these are frameworks, these are materials which are made available in these materials. You can download them from the WHO global website, and you can use them for your local advocacy. They are broken up into different materials, down materials, booklets, for example, global standards, implementation guidance, country case studies to look how countries have done it. And finally, and I'm coming back to this again, on school health services as one of the important components. So these are the general materials, the way how it goes. Again, it was said before, it's not so much about what to do, but how to do it, who to do it, and have the resources available. So these are materials available globally. So it was taken from the regional level up to the global level. And I think it's our task now to take it back to the regional level again, to say, okay, of these global approaches, what is fit for Europe, what is fit for our particular country or our particular region, and then go through an iterative quality improvement approach to improve the situation. These are levers where you can enter because you might have different people. You might have a principal, you might have a teacher, you might have parents, you might have a city councillor. So you have different ways of getting into it. I wanted to spend a minute on the school health services. We asked the question again in the survey in 2020, do the country have a policy to have a nurse or a school health professional in schools? And this is the answer. And you might find it surprising because you can see that most of the Eastern European countries say they had a policy to do this. And most of the Western European countries either didn't answer or say they didn't have it. Again, you have to dig more deeply into it, what it means in detail. But I think the sort of picture as you see it here is very interesting. And I think, again, this is something for the European Commission to keep in mind, that there is an area where work might be needed, particularly in the European Union. We have developed over the years standards for school health services, and again, as I showed you, has been taken up globally. And there are about 300 pages of evidence reviews to look at what sort of interventions actually could be promoted in schools and what are interventions which are normally not useful to put forward in schools. A classical example is monitoring blood pressure. That has been done by many, many school nurses, and it's, just to be blunt, one of the most useless interventions you can possibly do in a school. You are not going to identify the ones with high blood pressure. You see here is a menu coming up of 87 interventions, which might be useful to do them in schools. And then there are other interventions I just said, which are not useful. To come to the end of my talk, I wanted to talk about the leverage we are having from the WHO side to move forward. We had a child and adolescent health strategy in place up to 2020, and we have been lagging behind over the last few years. But suffice it to say, we are moving forward again. We got commitment from our regional director to move on with a new child and adolescent health strategy. Why is this important? Point. It's the way to interact with countries. And when you have a country dialogue about a particular problem across the board in health, you basically say, look, I mean, there has been a commitment by the regional committee that this is a standard which should be in place. How can we work towards this? So working for child and adolescent health, you are basically working on everything under the sun for this particular age group up to 18. So where is it important for the topic which we are dealing here with? We have made this little graphical element to break it up. You have the two columns, infant and young child, and you have school age and adolescence. And then you have the two big components. You have the preventive promotive one, and you can see health promoting schools is playing an important role in the preventive promotive part. When you come to the curative part, where we look at adolescent-friendly services and school health services, here is another component which can come in. So they have a promotion component, but they have to respond to illnesses, to problems as well. They are very often the first call for children who might have mental health problems or anxiety or something else. The other area which we have ignored so far is sexual reproductive health, particularly for young adolescents who are a bit shy to go out. This might be a good point of call to get services provided. So how do we develop a strategy? We went round end of the 2019, 2020 and came up with problem statements. And the problem statements here for the adolescent health group are things like this: adolescents face barriers in accessing sexual reproductive health services, or at the bottom, children are not taught in schools what they need to know about their health, present and future. So these are problems which we put to member states, ask them to say, is this a problem you are having? And many identified with these problems. And then you convert them into positive standards. Positive standards of things which should be there. So for example, the positive standard, the high-level statement is all schools are health-promoting schools. And then you go down into different standards and criteria where you go through what should be done. For example, global standards for health-promoting schools should be adopted. Schools join networks such as the Schools for Health and so on. And then you can tick through and say, are we achieving this or are we not achieving this? We are a member states organization. Our member states normally don't like us to tell them what we expect them to do. So in this way, with an approach like a regional strategy, you have an interactive process. You ask member states what they want us to do, but at the same time, you get a dialogue and say, look, I mean, we push the boundaries a little bit. You should do better. So I think I could show you a little bit in this very quick talk what the background has been for health promoting schools in Europe, the networks we are having, the SHE network and the HBSC network, which is providing a lot of information, how WHO is developing standards which you can look at and you adopt or adapt for your needs, and how we try to bring member states together to work together in promoting the health of children and adolescents. I didn't see any sign from Hof, so I think...
No, you're exactly in time. Thank you.
Thanks very much.
Thank you very much, Martin, for giving this very comprehensive overview. And clearly, WHO hasn't been sitting on their hands when it's about health and children and adolescents, and especially in the field of health promoting schools. And in the meantime, we're getting ready for what UNESCO has to say about this. We're very honored to have a presentation from UNESCO, which is the UN organization on education and culture. And it's been also a process over the years that also UNESCO as a UN organization is focusing more and more on health and well-being in schools. And this is a great development, I think, having these UN organization backing our work. We'll have a video talk by Tigran Egoyan. He is officially the Regional Health and Education Advisor for UNESCO for Eastern Europe and Central Asia. He's located in Moscow, where they have the Institute for Information Technology in Education, and he has a long experience in HIV and AIDS education, violence prevention, bullying, and so on. And we're very happy to have a short video message by Tigran.
Dear colleagues, dear ladies and gentlemen, imagine a young student, energized, engaged, and thriving, not just academically, but in every aspect of their life. This is not a distant dream, but the core of our vision to the School Health Initiative, a mission that recognizes the inseparable bond between health and education. Recent findings from the UN 2023 report, Ready to Learn and Thrive, School Health and Nutrition around the world, corroborate this bond with a wealth of evidence that healthier learners learn better, and good quality education is the foundation of health and well-being. Since the launch of the Global School Health Initiative in 1995, to increase the number of schools that can truly be called health-promoting schools, we have seen health-promoting schools blossom around the world. A global survey conducted by WHO in 2018-2019 found out that 2/3 of the 148 surveyed countries have national standards for health-promoting schools. However, let's confront the stark reality. Despite decades of efforts, the implementation of health-promoting schools remains inconsistent. For example, only half of the world's schools have adequate facilities for students with disabilities. In low-income countries, school feeding programs reach merely 20% of primary school students. 1 in 3 schools doesn't have basic amenities like clean drinking water and adequate sanitation. Only 51% of countries globally and 24% of low-income countries provide school-based mental health services and prevention programs. The challenge before us is not merely one of implementation, but one of reorientation. We must acknowledge that too often our approach to school health has been fragmented, focusing on single outcome like nutrition or deworming on something else. School health has been viewed as peripheral to education, lacking the integrated approach and support that it critically needs. We need a paradigm shift from siloed to fragmented school health interventions and projects to integrated comprehensive programs, from focusing on schools only to reorienting the entire education system towards health promoting one that makes every school a health promoting school. We need the education sector to recognize learners' health and well-being as core to its mandate. What does it entail? It means that there should be investment in the leadership for school health and well-being within education. It means that the education sector should make co-budget allocations for health and well-being. Health and well-being should be promoted through the curriculum and teaching methods. And education system should include health and well-being in their measures of success. It also means that teachers need to be trained differently to achieve the health and well-being outcomes. It means that they need to well understand how children and adolescents develop at different stages and need to know how to communicate messages about health and well-being in an age-appropriate and gender-sensitive way. UNESCO, in collaboration with WHO, UNICEF, World Food Programme, and other partners, stands committed to fostering the systemic change. The launch of the global standards and indicators for health promoting schools and a digital platform for monitoring school health mark a significant step towards fulfilling this commitment. As we embark on this journey, let's remember that every child deserves to be an environment that nurtures their overall health and well-being. It's time for us to bridge the gap between aspiration and reality and make every school a cradle for health, learning, and thriving futures. Thank you very much.
Thank you, Tigran. Although he's not here, I will convey the applause to him when I give a reflection on what his talk. And without further ado, we will now, as part of this plenary session, have a view from the national perspective, in this case from Spain. And I have the pleasure to introduce Maria Terol from the Spanish Ministry of Health, working in health promotion and equity, and Alvaro Hernando Freire, who is from the Ministry of Education in Spain, Head of Educational Program Service. And the floor is yours. You have 11 or 10 minutes, and we'll stick to the time. So please.
Thank you. Thank you very much. Well, good morning. Thank you very much for inviting us this seminar. We are going to present Spain's work on health promoting schools. This presentation is going to be made jointly by my colleague Alvaro Hernando and me, Maria Terol. And please excuse Ana Gil Luciano, who finally could not attend due to an unforeseen reason. Well, first, we would like to thank you for having international guidelines and frameworks. This helped to promote this work at the national level a lot. In Spain, there is a coordinated work between both sectors, education and health, consolidated under an agreement for the promotion of health at the school. In addition, it is included in the legislative framework and is a priority in different strategies from different sectors. Well, the competence of health and education are transferred to the regions. Therefore, coordination between the national and regional level is key. This map includes websites with networks of programs related to health promoting schools in all regions of Spain. As you can see, there is a lot of work, diverse and adapted to the reality of each territory. During the COVID pandemic, both sectors worked closely to ensure face-to-face education, to keep educational centers open, with health promotion and prevention measures and with a focus on equity. This successful experience of collaboration has led to focusing on health promoting school, responding to the current challenges of public health and well-being. In the Spanish presidency of the European Union, health promotion in schools has an important presence. The meeting of childhood obesity highlighted the importance of a multi-sectoral approach in which the educational sector plays a key role to address obesity in childhood. At meeting promoting healthy lifestyles to address chronicity, factors such as diet, smoking, or alcohol were identified to be addressed from an early age. The third meeting was dedicated to mental health. Action plans and emotional well-being strategy for the education area are key. Finally, the conference guaranteeing a healthy nutrition for all children in the European Union had a declaration that includes recommendations that emphasize the importance of at least one free school meal a day to tackle poverty. In conclusion, schools are key setting during childhood and youth to promote healthy lifestyles and living conditions. In this slide, we collect some of the policies to promote healthy and sustainable food in the school setting carried out from our colleagues of the Ministry of Social Rights, Consumption and Agenda 2030. In line with the European Regulation of Official Controls, Spain has published the Program 16 on school menus, vending machines and canteens in schools, and a protocol criteria for the evaluation of food supply. And in addition, a draft regulation for the promotion of healthy and sustainable food in schools is being developed. Some campaigns on school canteens has been carried out also. The Health Promoting School Guide has been elaborated by the Health Promoting Schools Working Group. This group is intersectoral with participation of several ministries, health and education that are coordinators, but also consumption, agriculture, equality, and ecological transition. In this group, all the regions participate, and as well in this group, some experts participate. We would like to underline that this is a consensual guide. This implies more time for preparation, but we hope that it will be adaptable to different regional networks and make networking easier. The guide has 3 parts. The first one includes the conceptual framework, and the working group has reached a consensus on 6 standards for health promoting school in Spain, adapting international models to our context. The second part covers how to become a health promoting school. It includes some basic commitments for schools to start working on, and some aspects to be done on others that should be avoided, and some precautions for schools to be places of special protection against marketing. And the cycle of action that my colleague Álvaro is going to explain to you.
Thank you. Good morning, everybody. My intervention will be very brief and will refer to the part dedicated to the action cycle of health promoting schools and to the adaptation processes that we have provided to facilitate the understanding and viability of the model in the Spanish educational environment. I'm not going to comment on all the information that you can see in the slides, but we consider it is important to that you can consult it later if you are interested in it. This is about how. Sorry, I'm seeing the slides. The original instrument, as you can see, is the one proposed by She Networks through the She School Manual 2.0. So why is this adaptation necessary, considering this is a good model? First, it is necessary to point out that the Spanish system is peculiar, giving management autonomy to the historical regions. We have some capacity to develop regulations. Also, schools have a certain autonomy to intervention. So taking into account the different legislative frameworks as well as the operational reality of schools, we see that this cycle of action needs to address or redefine some terms. For example, in this first step, getting started, we consider it would involve the creation of spaces for dialogue, reflection, debate, awareness raising on the subject. And this is so because of the different reasons. For example, not all teaching teams are aware of the importance of health promotion in the school environment. One more reason is regarding with the school staff changes every academic year. So new staff deserves to be part of the building of these school projects. At this stage, it would also be necessary to outline or the responses to the challenges or to start thinking about the mission and vision. And the next step, you can see assessing your starting point, we would analyze the available resources, no changes comparing with the original cycle. It's not necessary to make an adaptation. In the slide, next slide, we can see this phase 3, planning for action. Here we would define the mission and vision, the objectives, the transversal and the sectional actions, the inclusion in the official documents of the schools and the elaboration of an intervention calendar. I mean, the most important object here would be to see which structures of the educational institutions might require some reinforcement or transformation. In the next phase, called taking action, that is implementation and development of action, monitoring, feedback, and some evaluation adjustments during the process. And finally, phase 5, monitoring and evaluation, would require the evaluation of everything carried out and the appropriate proposals for improvement, in addition to the dissemination and celebration of achievements and efforts. And this is important. This would lead to the shaping of the institution's identity signs, the distinguishing marks, accepting health promotion as a value. It's our way to help to change the school culture.
Okay.
And the third part of the guide.
You have 1 more minute.
Yes, I am going to. Includes some proposal for modifying the physical and social environment of education centers. The guide includes the determinants with the highest impact on public health, as you can see in the slide, but there are just a few examples to serve as inspiration for a school. And what is the strategy for its implementation? How to make progress in making every school a health promoting school? In the short term, we are going to disseminate the guide. We are going to offer an online training, and we are going to hold a conference. And we have plans for the launch of a Spanish network of health promoting schools as a network of regional networks, so that ministries support with coordination, training, exchange spaces, and international representation, and regions create or continue promoting regional networks, and they work directly with the schools. We leave you the links to the websites of both ministries, and as well as our contacts. And thank you very much for your attention.
Thank you very much, Maria and Alvaro, for your fascinating presentation and the development of Spain. This is a great example, I think, of how education and health work together, and also to do it on a federal level, you know, across the different regions. I know the situation in your country and as in other countries like Germany, how complicated it is to do this, and you do it, and using what is already there and making a next step. So really interesting. And with that, we are at the end of the session. I promised time for a discussion. There might be space for just one burning question or comment. So please do not hesitate to raise your finger, and there will be a mic. And when you have the mic, please be short in your question, and we hope to be short in the answer because the coffee is waiting. And please say your name and stand up. And what's your name and where you're from, who you're representing. Thank you.
Hi, Ali Dunhill from Eurochild. I'd like to ask my colleagues in front of me here from Spain a question, and it goes back to the original comment about sustainability. When you're looking at this health promotion school and you're creating an award, how do you maintain the award level that you originally assessed to give the award to the school?
So Well, the point is some different regions have programs working, so we cannot make an offer that excludes that kind of programs that, as we saw in the prior presentation, has some issues with sustainability. So what we try is to add all kind of interventions, programs, and actions, but we put our effort in changing the culture of the schools, trying to create these spaces for dialogue and for debate, because if not, probably staff teams will think they have a new task to accomplish, and it is not the goal. The goal is to help them to understand the importance of this variable in everything, in the result of the education. So it's part of the defense of the rights of the childhood for us. This is our point of vision.
Thank you. And I see one. Okay. One more. And please stand up, say your name, where you're from, and who you want to ask the question or comment, please.
I feel like it's cool.
It's fine.
I'm Peter. De Franceschi. I'm working for Eclair Network. I'm working on food. And indeed, first of all, congratulations to the EU presidency of Spain and your strong support of school meals. And I was also glad that in your presentation, food came up for the first time, because my question would be, can there be a health promoting school without food at school? I think health, education and food must be thought together. In Italy, there was even a court case which went up to the highest court, where the main debate was, is eating and food a part of education or not? And the verdict at the end was that the eating and the food was part of the education. But still, there is often not a link between education, health, and food, as if that would not be together. But without food at school, it's difficult to promote also health.
Thank you for your question. The thing is, we don't think we can work correctly without food regulations in the school environment, at least. It's not only about curricula, it's about control, it's about offering some variables that work against poverty or, disadvantage of some sectors of population. So it could be a contradiction in Spain, because some historical regions has no offering of food spaces. So kids come early in the morning and they leave the secondary high school with no space to have at least one healthy food per day. That we are working on that through the Spanish High Commission against the poverty. I think it's okay. We are working on that. Thank you for your question.
Thank you. Okay, and with that, I want to close this session. I want to thank all the speakers with their great talks and food for thought. We have coffee, and we'll start again at 11:30 sharp, I had to say.
So as you've noticed, we have really packed the agenda, because we have wonderful speakers with a lot of information, but not so much time for discussion. So we will be punctual, so at least not lose time in that respect. So up to now, we've really heard a lot about the health promoting school approach and about the different tools that are available at international level, as well as in Spain at the national level, to support this. We haven't yet heard that much about Schools for Health and the initiative, the project itself. So that's what this upcoming session will be about. And my colleague, Gabrielle Sutton, who's a project coordinator at EuroHealthNet and coordinating Schools for Health, amongst other things. So hats off. Keeps a calm and friendly face through it all. But she'll be presenting briefly on Schools for Health, very much since this is a policy seminar from the policy perspective. So the work that we are doing, have done around the policy context in different countries to again provide a basis, our understanding, and see if that corresponds to what, for example, Martin and Kevin presented in the opening session. And then we'll get a chance to meet and hear from all the partners about, very briefly again, but from the highlights regarding what they found about the policy context in their country and potentially entry points for action that we can build on throughout the course of the project. So Gabriela's presentation will build on a video that we've just developed, an introductory video that's very hot off the press. So let's dive into that, and then Gabriela can come up. And then after, we'll immediately move into the panel sessions with the partners that will be chaired by Orkan Okan. He's part of the steering group, part of the Schools for Health consortium also, and a steering group member. He's leading on evaluation in the project. And outside of that, he's also a leading expert on health literacy across Europe. So if you have health literacy questions, he's your man. And also a professor at the Technical University of Munich. So Gabriela.
Children and young people are the world's most valuable resource and our best hope for the future. The best investment we can make for children and youth is to safeguard their health and well-being from an early age so they can cope with current and upcoming challenges, achieve their full potential, and contribute to a better world. Schools play a key role in the academic, social, mental, and physical development of children and young people. That is why Schools for Health supports the movement to make all schools a health-promoting school. This approach makes health and well-being a central consideration in a school's structures, policies, and activities. It involves students, staff, and a wider school community in participatory processes to identify ways to promote the health and well-being of everyone in the school community and create a school environment and culture that supports this. In Schools for Health, we focus on what can be done to reach students who need more support and also consider the well-being of staff who are role models to students. 13 partners are working in 8 countries. They will engage the school community to implement best practices in areas of nutrition, physical activity, and mental health. These partners will work with policymakers and practitioners to exchange knowledge and experiences on how to strengthen health-promoting school approaches. Join us in our efforts to make schools microcosms of health and well-being, which provide children and youth with the skills and abilities to shape a more sustainable world. Because when children and young people feel better, they do better. For more information, visit the Schools for Health website.
Good morning, everyone. It's a pleasure to be here to be kicking off this rich panel session with an introduction to Schools for Health. So picking up from where the wonderful video left off, Schools for Health really recognizes the need for meaningful conversation and action across sectors to help shape healthier educational environments, now more than ever. We want to give renewed impetus to this momentum around health-promoting school approaches as a key entry point to understanding what we need in terms of getting the foundation right for child and adolescent health. Inspired and motivated by this approach, Schools for Health is an initiative that is being led by EuroHealthNet and strongly supported by 13 members in our partnership. We have partners from the Schools for Health Network Foundation, the UNESCO Chair for Global Health and Education, the International Sport and Culture Association, as well as our esteemed speakers in today's session, coming from Belgium, Greece, Hungary, Netherlands, Romania, Slovenia, Spain, Latvia, and last but not least, the Technical University of Munich. Yes, we're a big group. But that being said, the support that we receive today goes beyond this partnership, as attested by all of you joining us here in person and online. The Schools for Health is an initiative that is built on 3 key pillars. We've got the practice, the policy, and the engagement pillar. So as mentioned in the video, we are applying a participatory approach to engage 16 schools and their communities in the transfer and implementation of best practices around the themes of healthy nutrition, physical activity, and mental health, all the while making sure that we encompass this broader focus on health promoting schools. We recognize, however, that health promoting school approaches cannot be sustained without the right policy conditions in place. That is why Schools for Health aims to build a network of experts who are driving the conversation around child and adolescent health. This is being done across 8 of the participating countries with the intention of scoping the policy conditions that will support the implementation of whole school approaches. To capture this engagement, we will be developing toolkits and learning guides over the next months to really help build the capacities and awareness around the policymakers' understanding of the health promoting school approaches. These resources will be featured on the Schools for Health online hub, which also connects to other practical information in the forms of trainings, promising practices, and other existing materials around the health promoting school approach. As a first step to building this network, Schools for Health partners have reached out to experts across the fields of education, health, social policy, civil society, among others, through policy surveys and small roundtable discussions to really get a better understanding of the country context around health promotion in schools and, more importantly, health promoting school approaches. While partners today will go into more detail about their own policy findings in the following interventions, allow me to give you a few of the highlights. So preliminary findings show from this policy exercise that across participating countries, there is a level of awareness around the health promoting school approaches. While these approaches are considered important, the fact that they were recommended and not mandatory led to varied and sometimes weak implementation across school settings. With an emphasis of not overburdening schools, our initial findings indicate that mandatory legislation around the health promoting schools could lead to more uptake, but frameworks would need to be flexible enough to allow schools to make the necessary adaptations and provide the necessary support to their teaching staff as well. Other findings propose strengthening existing cooperation around schools, as well as establishing a central coordinating body within the schools to support with the relevant activities. Creating health promoting schools is not and should not solely focus on schools and teaching staff. From this policy exercise, we see how important the political and the structural determinants are in creating the necessary support to enable this comprehensive shift towards better health and well-being. As such, policymakers, public authorities, practitioners, and the broader school community equally have the responsibilities to drive this positive change and create healthier school environments. While this is, of course, easier said than done, our policy findings show the need to better communicate the value of health promoting school approaches and gain more widespread support across actors by focusing on promising entry points, such as, for example, the environmental agenda. Our aim is not to reinvent the wheel, but rather to utilize the existing resources and expertise to collectively steer towards the transformation that we need, where health and well-being of the schools are at the forefront. And this is what we hope to bring forward in the Schools for Health initiative over the next 2 years and beyond. Thank you for your attention.
In Munich, and we are going to see 2 panels now from the Schools for Health Consortium with 8 speakers in total. So let me just get my details right here. So we are going to start with with our first panel on strengthening health promoting school approaches and scaling up through policy. 4 presenters, each will be talking 5 minutes. Time limitation will be taken by Ingrid and Gabriela. It's very important that we keep time in mind. And after the 20 minutes of presentation, we are going to have a 10-minute open question and answer discussion with you, with the auditorium. And I would like to start with our first speaker now from Romania, Petru Sandu. He's a specialist medical doctor in public health and management at the National Institute of Public Health. Welcome, Petru, and we are really looking forward to listen to your presentation.
Thank you. Hi, everyone. My name is Petru Sandu. I work at the National Institute of Public Health in Romania, and I will try very briefly in about 5 minutes to summarize the results of the policy analysis work that we have conducted in the first year of the Schools for Health program. So, David, if you can go to the next slide, please. So I was thinking that maybe Gabriela will tell you about this, but actually our work was divided in 2 big parts. We had a rapid survey, rapid situation analysis that was conducted through a survey that we developed within the project, and then we sent to key stakeholders that we identified in the policy system in each country. And following this rapid situation analysis that was conducted through survey, we had a roundtable at the regional or national level in which we tried to contextualize and validate the results that we have achieved through the first part of the data collection through the rapid situation analysis. So this is a photo from our roundtable that took place in Cluj-Napoca in Romania. We had 14 participants, and you can see there the division between most of them were from the health and education sector, actually. And all of them were women. And why did I put this detail? Because one of the participants noticed that all of them were women and make this connection about the role of women as mothers and how they take more care of children. And it was an interesting, detail that I thought I will share with you. So this is how the discussion go. We introduced, so each of the participants introduced themselves. Then we had the presentation of the School for Health project and of the results of this rapid situation analysis survey, and then we try to validate and contextualize the results that we have obtained. Please, David, thank you. So this is a lot of text. I'll try to run you through this text, but maybe I will start with the conclusion or the take-home message. So although it's not a part of Health Promoting Schools program, in Romania there are several Health Promoting Schools relevant initiatives, especially pertaining to the health and education sectors. So this is more our conclusion as researchers, raising awareness or advocating the health promoting schools concept to the relevant stakeholders could support the current initiatives and potentially increase their concerted impact. And now going back a little bit to the, to the key relevant policies that we have identified. So we have in Romania the EU Fruit and Milk Scheme. We have another program that is used to be called the Warm Meal in Schools, and now it transformed into Healthy Meal program, and it was a pilot program for 50 schools, and now it's in 450 schools, so it's getting bigger. So this is a good sign. We have the National School Sports Olympiad. We have health education as a class, but it's an optional class. It's not compulsory. We have school medicine services, which I saw from a presentation before that is not so. It's not in all countries in Europe. So this is a positive program that we have. It's a positive aspect. We have anti-bullying legislation. We have national program for health promotion, and we also have legislation for hygiene norms in schools and a list of non-recommended food items and nutritional guidelines. So this is actually the result of our desk analysis and our survey that I told you about. And now a little bit about key relevant discussion points that we had in the roundtable. Health education and social services are the most relevant sectors for health promoting schools in Romania. So this is one of the conclusions from this discussion. School decided curriculum, so teachers can actually propose some classes that will be relevant to this concept of health promoting schools. And this could be maybe an opportunity to push this agenda. And that we have no legislation or initiatives targeting school staff well-being, which is an important and integral part when we think about health promoting schools and whole school approaches. Some barriers, ambiguous or non-binding legislative framework, shortage in funds and human resources, and overloaded curriculum. Maybe these are relevant for more countries. And some opportunities, we have, or an opportunity will be to have sufficient well-trained and motivated human resource. And some recommendations from the participants in our roundtable were that the development of health programs for school staff, involvement of parents, scaling up the current initiatives, and increasing the resources to support children with special educational needs. And then I will come back to the conclusions that although we do not have a structured health promoting schools program, we have initiatives that with the right level of advocacy and raising awareness could be structured up in a more integrated program. Thank you.
Thank you so much, Petru. As I said, there will be questions after the panel one. And our next speaker is Sinja Datava from Latvia. She's a senior specialist expert from Riga City Council Welfare Department. Welcome, Sinja. And don't get annoyed with the red and the yellow cards. They're just part of our makeup here.
Okay, I will try to. Hello, everyone. It's very nice to be here. And yeah, I will very briefly, very short, tell you about our policy rapid situation analysis in Riga City Council, which is in Latvia. So firstly, I will start with the rapid situation analysis survey. We sent out the survey to 14 stakeholders, and we received back only 7 responses. It was sent out to public health specialists, policymakers, policy experts, school personnel, educational board specialists, students, representatives of Ministry of Health, and urban planning specialists and social workers. And the key highlights were that almost all respondents answered that they are aware of the concept of health promoting schools and ideas it represents. The majority answered that health promotion in state and municipality level institutions like schools is not given sufficient attention, or it is given only partially, mainly due to limited funding and human resources, and also there are other priorities. Also, the biggest part answered that they don't know any policies that specifically address the health and well-being of teachers and the other staff working in schools, and also they didn't know any guidelines or resources that support schools' effort to become a health-promoting school. And yes, everyone knew that there are legal policy instruments in place to regulate obesogenic environments and promote healthy living within school zones. And the main obstacles for health promoting implementation in schools were mentioned: lack of specialists, funding, low salary for teachers, lack of understanding the importance of health promotion, and lack of motivation for teachers. And moving forward to our roundtable, it took place on 12th of October. It was attended by 17 stakeholders, and there were represented school personnel, students, parents, politicians, public health specialists, and other colleagues from different departments. And the key highlights were very similar, the ones that we see in the surveys. So that final conclusions was that biggest challenge is the lack of funding in Riga, lack of interest of understanding this importance of health promoting schools, lack of motivation, low salaries for teachers in the schools. And when we talk more about policy level and politicians, we came to the fact that there is no political unity and consistency, because every 4 years there is new elections in our city council, and so the politicians change, and with them changes the priorities and interests. So it's harder to convince them about our plans and needs and the importance of our work. And yeah, there should be unity and common strategy. But the positive thing that I can tell is our employees, my colleagues, they have developed good communication and cooperation between schools, school teachers, school personnel, and the schools trust our employees, and they are very willing to participate in the activities we provide and organize for them. So yeah, that is the very bonus of our specialists, my colleagues. So yeah, that's all. Thank you.
Thank you so much, Senior. Now we are moving on to our next presenter from Greece, Martina Kouvari. Welcome, Martina. Martina is Director of Nutrition Design and Research at the Prolepsis Institute in Greece. The floor is yours.
Hello, nice to meet you. Thank you once again, Giro Helfnet, for this wonderful conference. In the next 5 minutes, I'm trying to present you how we mapped the policy in relation to health promoting school in Greece. So in September 2023, we implemented 2 roundtables, to be honest, with 20 participants in total. The first one had to do with the school staff. So we invited teachers, health practitioners at schools like school nurses, school principals, and so on. And the next one had to do with policymakers and academics in the field of promoting health in the school level in childhood and adolescence. So I tried to sum up this way somehow our key highlights. So the main conclusion that we have is that we indeed have health promotion activities at our schools, but we do not have the whole school policy in none of our schools. Most of the participants seem to understand somehow the concept of health promoting school, but I'm not sure that they exactly know what it means, what we mean with this approach. To make myself more specific, what we found is that we have some initiatives that are related with promoting healthy nutrition at schools, like the schools meals program that we have. And very recently, from 2021, basically, we have the skill labs, which is a school policy that is obligatory for primary schools, where each class has to follow a specific project on a specific thematic area that has been decided. So this is assigned more or less to the teacher. So is this teacher's responsibility to implement this skill lab following specific thematic areas. For example, 1 year they can choose nutrition, next year they can choose mental health, and they can take ideas for the educational program that they're going to implement by the Institute of Educational Policy, where we have a platform with certified educational programs. Other things that we have is some counseling offices like the KEDASI, it's Interdisciplinary Evaluation Counseling and Support Centers, which have to do with mapping mental health and psychoeducational services in Greece. And other things that are mentioned like recommended, not required or obligatory. It's a regulation for schools about school canteens, for example, the standards, the nutritional standards that have to do with the school's canteens. What's the problem with all this? All these are really great initiatives, but the main barrier here is that there is lack of sufficient monitoring of all these activities. So we have a very narrow evaluation if these are implemented and if they are indeed efficient. And another problem that I would like to highlight, taking the opportunity of what we mentioned before, it's not about what. We know what thematic areas we need to focus. It's about how, and basically it's about by whom this needs to be implemented. The main barrier that it was reported in our roundtable was the fact that these are always assigned to the teacher. So we consider the teacher is the main agent of these interventions that we are talking about, and not a part of this process. It's like the mean we use to implement this intervention, but they do not have time, they do not have the energy, they have low salaries, as previous speakers mentioned about. So this is gaps that we need to consider. And last but not least, we're talking about health at schools. So we are involving 2 ministries, Ministry of Health and Ministry of Education. This means 2 separate agendas, 2 different priorities. There is no interaction between these 2 ministries. And this was the main problem that we have also in Greece. Thank you very much.
Thank you so much, Martina. And now we are going over to our last speaker in panel 1 from Hungary, and that's Fanny Mezaros, health promoter from the National Center of Public Health and Pharmacy in Hungary. Welcome, Fanny, and the floor is yours.
Thank you. Thank you so much and welcome, everyone. Let me briefly introduce our school health promotion system. In Hungary, we have comprehensive school health promotion since 2016, which is made mandatory by law. It's obligatory in all public education institutions in Hungary, which focuses on four main tasks like healthy nutrition, mental health, physical education, and health knowledge. And there are other like decree regulated programs such as a healthy buffet, healthy canteen, and daily physical education. Although these are obligatory, the law does not require feedback, evaluation, and monitoring either. So the implementation is school specific, depending on the resources. So when we organized a roundtable, we wanted to create a group of professionals from different areas connected to school health, such as teachers in graduate studies, EU project leaders, education researchers, as well as colleagues from the ministry who are directly involved in decision making. So during the roundtable, we realized that some part of the national school program works better than we expected. Why some is not as good as we awaited. But let me start the positive side. So as you can see, 6 sectors are actively involved in school health, and which is more important that they are agree on the point of view that there is a profitable investment for the schools, for the communities, and even for the level of society. As you can see, the topics are kind of varied. Many of them appear. That gives a holistic view for the students. As I already mentioned, the country policies require this action in schools, but we have our challenges. There are huge differences among the schools. For sure, there is a lack of resources, many financing programs, and missing motivation. We think that this could be solved by making teachers' careers more attractive, which is not at this moment, unfortunately. Some initiatives started, but many are ahead of us. Our program does not include teachers and other staff workers in school. Their health and the well-being is managed only by occupational physicians, which is clearly not specific. And during the roundtable, we learned that the flow of information is interrupted. That means we need to work on that too. The monitoring is missing, as I mentioned before. The school do not give feedback on the work, so there is no proper information about the efficiency of the program. These 3 problems must be made up into the program as soon as possible, no doubt. But thanks to the roundtable, which is quite intensive and active, we have a great group behind us, and we will do our best to make the school have even better in Hungary. And it has a wonderful base and support from many sides, and this project can give us another aspect as well. So we'll do our best. Thank you so much.
Thank you so much, Fanny. And now we have like 10 minutes for an open discussion and question and answer. And before I start with it, since we are very much involved with evaluating these kind of results, there is one commonality I was able to identify across all 4 speakers, and this is that people involved with education and health in the respective countries all had concerns that there is a lack of resources, meaning time and energy, political commitment, funding, collaboration, missing trainings, health expertise, and collaboration. And I think this is very important, a structural dimension that we need to overcome before we delve into behavioral or other approaches. So the floor is open. Any questions to any of the speakers? And it might be helpful, for example, if all 4 speakers would come here in front. That would be nice. Can you all come here? And then we'll be able to see you and direct the questions to you. So just raise your hands for a question to our speakers. I mean, I have prepared a lot of questions here, but please, the floor is yours. Please.
was more a question for Fanny, because that was in the last presentation you were talking about the flow of information interrupted and that there's more need for efficiency and follow-up. If you can, especially around the flow of information, just elaborate, because I'm not sure if I completely understood what.
Yeah, so they just said that there is no information between the schools, and it's really hard to get information from the ministry, from our side. So when they have like a program, a best practice or something, they cannot share. They don't know about these options as well. Yeah, so but I think that there are some possibilities to work on that, and we didn't know about this problem actually, so we thought that we have like a website that we thought that works great and that it's available for everyone. It's an open website, so anybody can check it, and we thought that they use it and that can give them enough information, but we just realized that it's not happening, it's not working. So probably, yeah, we need to work on that, but we didn't know about this problem. So that was like a totally new things for us.
Thank you so much. Then we have another question by Hoof.
Yeah, maybe what I noticed, I mean, great presentations. My question, and one of you can answer that, is you're all working in the health sector. And how was it for you to get the education sector representatives involved in this project? And what are your experience with that?
Thank you. It's actually a very good question because yeah, education is not traditionally involved in health. But in Romania, when a public institution asks another public institution to participate in something, they usually you have a positive response. If they would have been a university or an NGO or someone else, they would have invited a public institution to participate in an activity within a project, maybe they wouldn't have replied positively. But this was the actual connection, the fact that there were two public institutions, and this is that facilitated the positive response in the case of Romania.
Hello, thank you very much for the useful presentations. My name is Andrea Lapeng. I work for the Lifelong Learning Platform. And we often say that we should have a learner-centered approach in education, which means not only building things around learners' needs, but also involving learners in decision-making processes, especially in schools, because schools in the end are the hub for our democracy to then flourish. And I've seen it transversally in all the presentations, including the presentations this morning from institutions. How do you plan to involve not only teachers, head schools, but also the pupils themselves in the design of these new programs? This is still escaping me a little bit. Thank you.
Yeah, that's a really good question. We actually had a few years ago a program focused on physical education classes in high school students, and it was an Erasmus Plus sport program. And the focus of the program was to ask students what they want to do in physical education. But unfortunately, students don't know what they want to do because they don't have the skills, they don't have the knowledge, and most of them are disinterested in physical education in this case, right? So yeah, of course, it's a very valid point because we don't want to come from above and tell them this is what we think is good for you. But on the other hand, we have to be aware that you need to select students that are interested in these topics, health education or physical education and so on. So yeah, it's a really good discussion point, but I don't think there's a clear answer. Thank you.
Just to add something on this, because in the Schools for Health, what we're going to do now that we are designing our piloting is that we are going to map somehow the schools on which we are going to implement our intervention. So our point is that we are going to do a need assessment on what exactly they need, who they need to get involved, and the plan is not to just include the teacher on this or ask the teacher to do something, but to have a multidisciplinary team who will have the expertise to implement what we are going to do.
Yes, thank you a lot for your question, because indeed learner-centered approaches, it's what we work with, and involving the learner in the process, it's something very, very innovative, and it's just the starting of it. And it's particularly relevant also for anti-bullying programs, because you can't build a sustainable anti-bullying program without involving those which are concerned. My question is, so first comment, thanks also for raising the attention that teacher well-being needs to be addressed, and health. My question goes a little bit deeper into the cooperation between health and education. We are speaking a lot about promotion, about the different schemes and so on. But when we come to mental health conditions or mental health needs, or whatever type of needs, special education needs also falls under this. How do we make the conditions that the different actors concerned about a case, about a learner's specific case, are collaborating in order to be able to do what is best to support the learner in the trajectory. This is something that comes quite strongly. How do you come across all these aspects related to not sharing information and confidentiality? So what could the policymakers do further to put the condition in place that this cooperation works, and it's valid not only between education and health, but also between justice, police, and depending on the situation. But this is a huge gap.
I think it's a really good question for policymakers.
Yeah.
We are not policymakers, so. Yeah.
So, for example, in Hungary we have they created a credit system for teachers, so it's not obligatory to choose like a health promotion topic, but they have possibilities. Maybe that was the only initiation from policy makers to involve like the teachers. And if that was your question, like how the policymakers involved. Okay. Yeah. I think that's gonna be the lack of information.
Right. I wanted to exactly say that you had that on your slides, right? As a missing point, the lack of communication and information, a system that might be needed. I do not want to cut this great discussion, but maybe this question can also be answered in our second panel. First of all, thanks to our distinguished speakers of panel one. That was amazing. And we learned about HPS approaches and how we scale them up through policy. And now we move to how we can improve the health promoting approaches and doing better through policy, actually. And it's the same format. We are going to have 4 speakers, and we start with Luus Neuwen from Belgium. She's an innovation manager at Gezond Leven in Netherlands.
In Belgium.
Belgium, sorry, in Belgium.
And I will specify that because thank you for giving me the opportunity to present a little bit on the policy context on health promotion and whole school approaches to health promotion in Flanders. So this is a regional perspective of the northern part of Belgium. We organized a roundtable last September. We had over 20 attendees, mainly people, representatives from the administration of education, of the Department of Health, but also from other policy domains, a lot of stakeholders, a lot of organizations like ourselves working in the field of health promotion. You can move to the next slide, please. Well, and in the report, we created an overview of the current policy situation in Flanders. I've just put up a few highlights here. This is definitely not the whole situation. You can find the report, or you can ask me or some of my colleagues that are here today if you want to know more. But what do we have in place? We kind of have, we cannot complain about the framework that we have in Belgium or in Flanders. The tools, the framework, the legislative framework even, it is there. We have set out educational goals, giving attention to health. We have a decree on student guidance where it is described as mandatory to have a policy on student guidance and paying attention to their physical and mental well-being. Also, the Department of the Ministry of Health also has a strategy, a 5-year strategy in place, working on health promotion in schools. We had the introductory video from our Minister of Health. She referred to the target that by 2025, we want 80% of elementary schools and secondary schools to have a minimal qualitative health policy in place. Our organization, but many others, offer a wide variety in tools, interventions, and support to schools to work on different health aspects: nutrition, physical activity, mental well-being, oral hygiene, prevention of drug and alcohol abuse. It's all there. So it's not the lack of resources that we are talking about today. There's a close collaboration, a year-long close collaboration between the Department of Education and the Department of Health. Also regular collaboration with, for example, policy domains like agriculture. For example, the EU School Fruit Scheme has been very active and implemented in Flanders. Collaboration with the Department of Environment to find collaboration between health and environmental aspects. It's all there. But in theory, this always sounds well, but of course, in Flanders, we also face some challenges. Many of them have been mentioned from the keynote, from other countries, and we also see them in Flanders. For example, the legal or the policy frameworks that we have in place, they are up for interpretation. They are often not very binding. So schools can choose how they implement it to a lesser or a wider extent. Of course, this mainly depends on what their priorities are. And currently, health promotion is inferior to other priorities. And it's not a criticism to schools. It's logical these days. They face a lot of crisis, like Kevin introduced. So there is no time, no capacity left to work in an integrated way on health promotion, on health promoting the whole school approach to health. And therefore, teachers turn back to their main mission, and that is to educate children. We also have to look at ourselves, at our organization. Currently, there are over 15 organizations, including Gezond Leven, that are working towards the schools in a fragmented way, trying to reach schools with their own topic. Do you want to work on nutrition? Do you want to work on mental health? Here is tools, here are educational packages. How can we bring that all together and make it very easy to use and not too complex? As a last challenge, I want to mention there are possibilities for schools to get support. For example, by pedagogical services and by student guidance services, but mainly they act on demand of schools. But of course, when schools are mainly focused on their educational mission and don't have the capacity, time, or resources to work on health, these demands are not coming or are not coming enough, and only by the very motivated schools and teachers. Often also these student guidance services are called upon in case of individual problems, students having a mental breakdown or having special needs. So they are mainly focused on individual care and not the holistic approach to act upon. Prevention is better than cure, we say, but nowadays more often we focus on individual care, and there's no room left for working on prevention. But there are, of course, also opportunities. We want to end on a positive note. The opportunities we have seen for Flanders from the roundtable is that, of course, it starts with an increased effort for collaboration and a more clustered approach of these schools by the health sector and by other stakeholders. And we've actually been working on that for a few years now. My colleague Tineke, credits to you for trying to bring it together and go towards the schools with joint forces. Also, we can optimize the supporting role of the pedagogical services and the student guidance that actually can go into schools and help them start with an integrated health policy. 2024 is also an important year for Flanders and Belgium with upcoming elections in June. We have them at the European level, but also at the regional and federal level. So this, of course, brings an opportunity. And also we will have the renewal of our strategic plan for health promotion in Flanders in general. So we want to include health promotion in schools, of course, again, in those targets. Maybe I want to jump in on Oana's question, saying that, well, how can we arrange, how can we
maybe
improve?
with the questions later, because you're already 3 minutes over time.
Okay. Am I talking?
And
okay.
but maybe you
I'm
finish your
sorry for
presentation.
ignoring you.
Maybe
I
you
just
finish
wanted
your
to
presentation,
end
and
that.
then we could move over to Milton Klopp.
What is most important, and I'm hitting on these elections, the importance of political choices and support, and that are renewed every 4 years. But behind that, there are people that are continuously and structurally working, and they need to keep finding each other, keep communicating to each other, and that is what I think is the main ingredient. Thank you, and sorry for.
Thank you so much, Luz. And now we move on to our next presenter, and this one is actually from the Netherlands, Milton Klopp, scientific expert for healthy school and healthy childcare, Dutch National Public Health Institute. The floor is yours.
Thank you. Yeah, really nice to be here and nice to meet you now in person. I would like to tell you something about the policy context in the Netherlands, about health promotion in schools. In the Netherlands, we do have legislation on health promotion, and these mandatory guidelines are focused on physical education, social, emotional development, and attention to sexuality and sexual diversity. And in addition to these mandatory guidelines, we also have national policies. And these national policies are voluntary and implemented on a decentralized basis. And this means that each municipality and schools have the freedom to fill in these national policies fitting to their situation. There are a lot of voluntary programs and initiatives in the Netherlands, and one of these is the Healthy School Program. Yeah, thank you. No, the previous. And in this program, we are aiming to get structural attention for a healthy lifestyle in schools, teaching students and pupils how to have healthy behavior and how to make healthy choices. And this program provides schools a roadmap which is based on the HPS framework and its pillars. And in addition to that, we also provide knowledge, workshops, and tools to support working on health promotion. And when it's necessary, they get funding and also advice from local advisors. The Healthy School Program is a cross-sectoral cooperation by 5 organizations. This is a local and national public health organizations and 3 educational councils, and it's funded by 4 ministries. So here you see the impacting factors for implementation, on which we reflected in the round table we had. And I would like to highlight 2 of these factors. So even though we have health in all policies, meaning that the 4 ministries are financing health promotion in schools, it also causes the separation of assignments given, and also these separated assignments are also given to different programs. And this means that there isn't always alignment between these assignments, which also hinders the collaboration on practical level. What's an enabling factor is that a strong network around the school will support schools to implement health promotion, and we should really focus more on that. So that makes, I want to go to the next slide. So in line with that, we think we should make health promotion part of the curriculum to stimulate schools to focus more on health promotion, but also facilitate them and focus more on strengthening the network around schools to make sure the pressure is a bit released of the schools and they are supported by the organizations around them. And lastly, we would really benefit from more alignment between ministries and the assignments given to the different programs and organizations working on health promotion. Thank you.
Thank you so much, Mirte. And now we go further south in Europe to Spain, Andalusia. We have Maria del Rocio Hernandez Soto. She's Managing Director of the Aljaferre Sevilla Norte Primary Care Health District in Andalusia Health Services. Welcome, Maria. The floor is yours.
Okay, thank you very much. I'm very happy for being here. It's great. It's been an amazing morning. And I feel very small with all the so important speakers that have been talking the whole morning. So I will try to focus on the reality we live in Andalusia. And first of all, I want to thank the Andalusian Schools for Health team. Pablo is here. He belongs to the Department of Health. Lola is just about to arrive. And the rest of the team are connected online. So this is for them because they are the real protagonists and actors of this work. In Andalusia, we have a tradition of working in promotion of health in schools. And this is a program that is carried out in public schools and publicly funded educational centers. And we have been working since before 2015, but since 2015 to 2023, I would say 2015, 2023, I think it's this year. We have been working on promotion of health with 2 modalities. The first one is for primary schools for children from 3 to 12 years old. And in the last year, around 600,000 students benefit from this program that is called Creciendo en Salud. There's another one for secondary schools called Forma Joven. And in the last year, around 300,000 children had some participation in the different activities. Since 2021, we have 2 new pilot projects, and one is for early childhood schools. And the second one is the Andalusian network of health promoting schools. This is like some kind of excellent level. We have also a tradition of collaboration and working with health, education, social services, and agriculture. And this is very important because this means that, okay, coordination is complicated, but we did it, we made it. and we are working on it more and more. So this is some part of the results of the analysis, but we can keep on going there. Some key elements is like we have a very strong commitment from the management team of the schools. We have family participations. Maybe we need to improve this because, you know, it's like we all live in a very busy life and sometimes it's not easy to get to families. We also have very different working areas under the same program because it's not only the promotion of healthy lifestyles, but it's also healthy relationships based on equality and the prevention of drug abuse as well. And we also work on a salutogenic model because we cannot forget social determinants that can cause health inequalities, right? We also need to focus on how we work together and how is this valued in Andalusia. And we must say that these programs are really implemented, they are consolidated, and they are very positively valued. So this is like a summary. We can give you more information, but as the time is very limited, we just wanted to recall this. And some challenges. Okay, we have challenges. And one is, as I said before, we need more involvement from the community, from the school community, parents and students. And the truth is that students have a very important role in these programs as mediators, because we have to take care of the privacy of teenagers, mostly in high schools, when they want to get some information and about sexual information and all. We need more training for all the stakeholders that are involved. And measures to do. Okay, we have 411 school nurses in Andalusia, and their main role is the promotion of health under a holistic approach and a positive health approach. And this is very important because we need to integrate this, and we are going to reinforce the relationship between education, as we said. In fact, we have a meeting next week, education and health departments, to keep on with this work about schools for health. So this is just a brief summary. And if you need any more info, we are here. Pablo and Lola is just coming, so we can give it to you. Thank you very much. Thanks for your attention.
Thank you so much, Maria. And now we are coming to our last panelist from Slovenia. That's Polonia Truden she's a public health specialist from the National Institute of Public Health. Look forward to
Thank you. Hi, everybody. I have 2 slides that are a bit different, just some points to show what we did through our, it's very packed. I was told they can be only 2, so. But our work focused mostly in, we started within the project group, collecting all the information, and then we contacted the stakeholders, the representatives of different stakeholders and experts in different fields, and we then concluded with this roundtable discussion. So basically, just to show, Slovenia has been part of the European network of healthy schools now for 30 years. I'm very grateful for all the presentations from Martin Weber that showed all this fabulous work that has been done in the past and we can build upon. So we have quite a large proportion of schools within the network, although here it's also an issue of sustainability, how you get the school staff to keep working in the field of health promotion. Although the health promotion in Slovenia is mostly done from the healthcare sector, there is this cooperation between healthcare and the school. Firstly, if we speak about the food and school meals provision, Slovenia is quite famous for a very well-established system of school meals. However, here we have recently some problems regarding shortage of staff, which is low paid. A lot of pressure on them to provide different dietary needs. So in this respect, there was this agreement with the primary pediatric services that the pediatricians provide prescriptions for school meals if there is the medical issue and the diet should be due to medical reasons, because the parents had all kinds of wishes regarding the school meals, and it became really very difficult for schools to keep up the school meals. Some schools just wanted to stop. So we have these actions regarding local foods like Slovenian Food Day and the traditional Slovenian breakfast. And now it has been a new strategy how to reduce waste in schools. It's becoming more important as now there's been another law passed that all the pupils will have free lunch at school. And it's envisaged that there will be more issue regarding food waste in school. So it's a lot of work to be how you put these things in the system, how you keep it sustainable. We have a lot of emphasis on physical education, that this will be presented by Professor Gregor Starc just after lunch. And we like to basically upgrade and connect this data with the health sector. So using this MySlowFit app, it's possible that the medical doctors can use this data when they assess the development of the child, when they assess obesity, for example, and they recruit patients for intervention at the primary healthcare level. Our preventive program has been updated in 2021, and now we have many people in different working groups to update the guidelines. And we are currently updating the guidelines on health promotion, health education for schools, for primary schools and secondary schools. I was mentioning this intervention on obesity at the primary healthcare level. Through the European project financing, we were able to set up health promotion centers at the primary care level, and we were able to employ dietitians, kinesiologists, and psychologists. So we have these multidisciplinary teams that are led by pediatricians, and they work together on the obesity intervention. For this kind of intervention, we get a permit from parents so that the health team can communicate with the school, and then the school provides more support for these children because they really need a lot of support to make a change in their life. And it's a lot of emphasis also in the local communities. So we cooperate with the mayors as well. So please, the next one. What are the challenges? I think in this kind of well-established system, when you look at the societal changes, there are many challenges. And we have now, for example, a national strategic group that is pushing for vegan diet in schools. So it puts a lot of pressure on the people within the system and the cooperation. Then there's also an opportunity, and this project, Schools for Health, is basically an excellent opportunity to test something new, to upgrade something, to add on, and we hope that we can later implement it in Slovenia in general. What was already mentioned is that there is also an issue with resources. We have an advantage as we are all, we have this coordination with the international public health system. So that's perhaps helpful within a small country. So we are all in one place and we communicate a lot within the institute. Another issue that's all the time at the forefront is how is our communication with the target groups, how you communicate with young people, and this is a very important issue. So thank you very much.
Thank you so much, Polonka. May I ask the speakers again to come to the front? And we have like 8-9 minutes for question and answers now. And maybe before I take your questions, again, there was one theme that I was able to identify across your presentations, and that is that health topics are inferior to traditional educational topics, and schools don't see an added link value whatsoever to address health. But I think this is where Kevin's presentations come into place, the logic model that he has shown, how addressing health also contributes for the school to achieve their educational goals. And I think that's something we should keep in mind. Any questions to our speakers now? In the back, there is one question.
Does it work? Hello? Yes, Petra Kogelnik from the European Parents Association. Thank you, first of all, very much for the very interesting presentations of this morning and everything you presented as well. What I'd like to state is because I really see that most of you are presenting the challenge analysis in one way or the other, which is very precious. But we also sometimes feel that the setting is not widened far enough, that there are only challenges that are directly linked to health and well-being are taken on board, but that we actually don't open the view far enough. For example, as far as the Flemish perspective is concerned, this is where I can talk a little bit more because I'm directly dealing with schools in Belgium in the Flemish part. What we see is that a big part of the burden of where it also comes from, that the settings are not healthy and not prone to well-being, is that the schools are under big strain, actually. So we think on the one hand, against what we seem to say, we think that the pedagogical freedom is very precious because it what makes this school system one of the best and definitely better in Belgium than the other. But what we see is that there is strain on school, for example, because of the size of classrooms. Classrooms are too big, and schools, in order to have support and assistance, sometimes what they need to do is they need to put some sort of label and diagnosis on a child. So they need to address to mental health issues, and sometimes they actually do invent them. They invent mental health issues where there are not, because that's the only way they will get support in classroom, to have additional assistance teachers. And this is something I think that is really taking the focus of a place where there could really be help. It actually shifts attention to something and creates something that is really, really not productive in the sense, whereas so much more could be done. So I think for us, really, we see the focus should be widened to more. More elements should be taken on board to really see the complete picture and not just look on the silo health issue. Apart from that, yeah, really very much appreciated, but maybe there's some possibility to go into this also later on during the afternoon sessions. Thank you very much.
Thank you so much for your comment from the perspective of parents. Any further questions? Yes, we have one in front here in the second row.
Hi, thank you for your presentations and the previous four as well. Ali Dunhill from Eurochild. Asking to the four of you and the previous speakers, have you ever considered involving children in the growing and cooking of the school lunches? This happens in Japan, it happens in schools in the UK. And I was just wondering if you've ever considered it from not only a healthy perspective, but also a curriculum perspective as well.
I can answer about that. In Andalusia, we don't have, in all the secondary schools, we don't have a kitchen, right? It's not many of them. And what we are trying to do is to get them involved in the diet. But the problem with children, and I can speak like that as a pediatrician, is that it's not only what they learn at school, it's what they have at home. So it's very complicated. But I think that's one of our challenges as well. But of course, if we could have kitchens in every school and give them some lessons about healthy diet and how to cook and all that, and we are working on that. And some of the schools that are involved in the Schools for Health program have a kitchen, and that's like a plus. Yeah, and that's very necessary. We need to involve children and families as well for that. Yeah, thanks.
I think there is another question.
Can I also add a bit?
Yep.
Yes, we have this part in the curriculum that they are practically cooking. It's not a lot of time because the mathematics and everything else is much more important. But there are these facilities, and we would like to use them for our intervention with healthcare. So we are trying, we have like cases in some parts that they are using it for teaching grandmothers how to cook for children not to gain more weight. So it should be like transgenerational. This is an important issue in Slovenia.
We have another question in the back here.
Hi everyone, I'm Ilaria and I represent Europe Active, and we represent the fitness and physical activity sector. And I'm saying that we're talking a lot about food and how healthy lifestyle can contribute to better educational outcomes. But I've just seen once in Slovenia representation that physical activity has been mentioned. So have you ever considered adding more activity or fitness activity in the educational curriculum? Since, okay, maybe food cannot be dealt with because we don't have the resource in the kitchen, facilities, but maybe we do have a gym or a sport school room. So what about maybe fostering more physical activity? And in this way, we can also lower the food issue. Thank you.
Thank you so much for the question.
Yes, I can maybe add to that. Of course, we couldn't give an extensive presentation, but there's also a lot of resources and tools and interventions available in Flanders to work on physical activity. And something we've been working on a lot is also the lowering of sedentary behavior. And because this is much more easy to be done within a classroom, to take short breaks and do small, what we call movement snacks. It's also proven that it increases the children's attention. So that's one way of working. And we have this intervention, Woogie Boogie, it's called. We had a collaboration with Disney, and it was very attractive, making videos. And this was one of the examples that was presented in the Schools for Health Good Practice Transfer. So there is quite some attention to that.
Just something around this, because it's not only that it's included in the curriculum, of course, but we are also working on safe roads. And these are programs outside of schools. So this is some kind of organization among parents. And one is the one in charge of taking the kids by foot to schools. And we are working that also with traffic police and all those. So it's not only what we can do at school, but before getting to school and after leaving the school, and of course at home. So yes, thanks.
Okay, thank you all so much. And I do not want to be the one staying between you and the well-deserved lunch. Therefore, we have to call it a panel. Thank you all so much, this group of speakers and also our first group of speakers.
My reflection from the first half of the day is that there's so much information to take in. There's so much things to reflect on that it can be hard to start thinking yourself. But you will be thinking yourself a little bit here. And what I thought was, where's the fun? And maybe it's because I'm coming from this physical activity side of things. We are dead serious. The topics are dead serious. But I don't know that we have been discussing where do we see the motivation and the fun and the children's engagement in that conversation. So from our perspective, grassroots sports and physical activity, the fun is not just an add-on. It's an essential way to keep children motivated. And remember, when you're also active physically together, you also get the added layer of social interaction and indeed motivation. So people are more likely to be active if they have something with and somebody to be active with. One other thing that I really feel like saying, because it seems to me to be a general misconception, now that we have a session on physical activity and nutrition, people tend to see them as somehow opposites. So if we just move more, we can also eat more. Or if we move more, we will magically become healthy and lose weight. This is so far from the truth, and I'm not going to move too far into my non-expert area of nutrition, but we should decouple some of these topics sometimes as well. I believe strongly that physical activity has value on its own for health purposes, but let's not talk about energy balance unless you want to have a fight. Good. So I will start off with Gregor, who has promised to give us an intervention. Gregor is with us from the University of Ljubljana, if I'm not mistaken, the Faculty of Sport. He has many roles and has engaged also in several of our initiatives, and he will talk to us about the Slow Fit program in Slovenia and also some international dimensions of that. So the floor is yours, Gregor. Any different? The thing is, how long it
Okay, thank you. This is the child's response. So they have other drivers. And we have to understand physical fitness as the basis of physical literacy. So if a child is fit, he's much more likely to easily learn many things in sports and then do this sports. Okay. Something going on? Okay. And of course, when you want to assess children's development, you have to use some kind of criteria. So we can use norms or criteria. You all know criterion. You know the WHO charts of body mass index, for example, growth charts, etc. So what we do in Slovenia, we combine both, because sometimes, you know, if you have criterion that is outdated already, it doesn't work very well. For example, WHO BMI charts don't work in Slovenia because our children are 4 centimeters taller than the reference population in the WHO. So it's useless for us to use it because most of the children would be overweight in Slovenia, but they are not, you know. So we use both the child performance compared to the peers and try to set up some criterion which is not fixed. We are constantly changing this criterion because there's new evidence, new data, and we are adjusting it to, in a few years, we get pretty close. What we do with physical fitness assessment, we assess, then give feedback. Feedback is the most important thing. So we give feedback to children, then teachers talk to children who need some extra help. So they have to set up goals and then design the plan, how to get to those goals, and then exercise. And then teachers help them track progress, you know, and if children see that they're progressing, it's of course very good. We use our data in informs policy making, and we can see how this data is used sometimes and for what purposes. For example, here you can see the fitness of Slovenian children. You see the 1980s, the steep improvement. You know, this is because we were building a lot of sport infrastructure in schools, new physical education curricula devoted to high quality physical education. So it improved. And then in the 90s and through the first decade of the second millennia, you can see the PlayStations, computers, and everything that entered our homes and changed the way the children behaved. So started to be sedentary and physical fitness started declining. And then in 2010, we started a healthy lifestyle program. This was an intervention in which children got 2 extra hours of physical education per week. So they went from 3 hours to 5 or from 2 hours to 4 or 5 sometimes. And after that, you can see the physical fitness improving. Just adding 2 extra hours in schools made a difference. And we knew that because we tested it before. But then, of course, COVID came. You can see the biggest drop in history of our surveillance. It was the biggest social experiment of our times and did a lot of damage. And of course, statistics are improving, but we have to be aware that 4 generations already left the educational system, which we didn't help or with anything, you know. So they were just left to get out of schools and improve the statistics by leaving. So things are improving, but not as good as we would like. So what we do in SlowFit, we have 8 fitness tests, 3 anthropometric measurements, and every April, all the schools in Slovenia do it. It's also part of the curricula. So this is why it's sustainable, because it's part of teachers' work. So what teachers do, they test children in schools, then send the raw data to the faculty of sport. We analyze the data, clean the data, and the schools get feedback 2 days usually after they send the data. So we are super fast because we have a lot of experience. So we had our software started developing in 1982. So now we are very advanced. So we use artificial intelligence, etc. So it's really working. So after we analyze it, they get school reports, and these school reports on individual level, because you have the data for every child, can be shared with parents. So parents have access to the data, and the parents are the one who can distribute this data to anybody they want to. It's their data. They can send it to a coach, to a school physician, to grandma, to anybody. Of course, we do national reports, communicate with the media all the time. So we are constantly putting pressure on policymakers as well, you know, because we say, okay, after 4 years of your government, the physical fitness of children declined. This was because of this, and this policy. So what are you going to do? So we are nasty sometimes, but we have to be, otherwise nothing gets done. So it started in 1982, the current system. This was this was the year when E.T. was out, the movie, you know it. So at the moment we have more than 8 million sets of measurements. So more than half of the currently living Slovenian population already has their fitness data from childhood. So this is very important. This is why maybe you can understand why parents want to do it, want to have it. So we can track every child for 13 years, from age 6 to age 18 or 19 sometimes. These are the reports they can get. These are individual reports. And they can immediately see whether the child is in the green zone or in the yellow zone or in the red zone. They can get advice from teachers and also some advice on online if they want to. You have reports on the class level, on the school level, so the principal can take this to the mayor and say, okay, this is our children, we have a problem, we want a new gym, so things are really getting done in this way. And of course, we use the data for individualist teaching and training to evaluate policies and interventions on national or local levels, to assess the environmental effects on somatic and fitness status of the entire population, and also for raising public awareness of the importance of daily physical activity, because physical fitness is the best indicator of physical activity. You don't have any device that's so accurate. I mean, every device gives out some different data, but you can see that if you exercise, if you are more physically active, your fitness does improve. So we are really also changing family lifestyles, because parents constantly see this data. When they see a child with a problem, many parents say, okay, we'll start living differently. Every weekend we go to the mountains. We do this, we do this and that, So it does help. And of course, it gives us information what's going on with the population. We can see that the children who were affected by the COVID, they came out with only 8% improvement of endurance in comparison to previous generations. So we can see the real effects very clearly. And in 2021, we started also slow fit adults. So we are now providing all the population, young to old, to monitor the physical fitness their entire life, and it's good. And a lot of adult and elderly people want to get tested. So we have thousands of people tested every year. But then, of course, slow fit is so advanced and it's so complex that it's very hard for the countries to implement it, and we know that. And this is why we set up a network of feedback network, where we produced a platform which everybody can use for free. So there is no excuse anymore. You can't have physical fitness testing. You can. And we did this for teachers and coaches, for researchers, and also for policymakers. So the policymakers, for them, we also created the 10 steps to establish monitoring. So they have like a plan how to do it, step by step, and they can use it for free. So tomorrow we'll have a presentation of this. So I will show it in live. All people who are there, you will be able to see how this works. So this is free of charge. And if any country wants to upgrade it into their national system or something else, then they can just put the database behind it and use it. So nobody will be charged anything. This is what we want to do for free, because we believe that this has to be freely available to everybody. So these are for example, you just input your data and you get back the results. You can also use a group sheet, so you can get the results for the entire class, for example. So it's very visual, very understandable, and it can be used in any setting. And it's very, of course, it's very easy to use, because you only have 3 fitness tests here, not 8 like in slow fit, for example, and basically can be implemented in any country, any school. You just have to start somewhere and then grow with it, because we firmly believe that knowledge can move the world, and we have to know where our children are, what's happening to them, to have some reasonable policies implemented and making a change. Okay, thank you.
Thank you very much, Gregor. You may stay, because we will see if there's any immediate comments, questions for clarification, or just reflections on this. And since you brought up ET, maybe I can bring up a song from the good old days. You're in the army now, it was called. I wonder if this is the question we'll get. Let's see. Are we in the army now? What do you think of Gregor's presentation? Any questions, please? We ask you to do the mic because we have streaming here.
We were asking ourselves, what do you do with follow-up? Because I know it's not a mental health session, but I can understand that children who get the report and yeah, that's quite personal, because I understand everything from the school level, but the personal level can be quite hard and can be a big influence on the children. Is there also a follow-up, or how is it implemented?
So we are talking about the communication between teacher and pupil, for example, with the feedback. Yeah, I mean, we have protocols how to do it. I mean, we train teachers to do it. So, for example, all physical education teachers in Slovenia are educated at one institution, at my faculty, and they have 3 different courses in which this is addressed. Also in psychology classes. So when they come to schools, they hit the ground running. So they know exactly what they have to do. They are very well trained, and this is why we can have it nationwide in every school. So we have every year more than 96% of the population is tested. This is more than obligatory vaccination in Slovenia. So we have more children tested than vaccinated, and they would have to be vaccinated by law. And this is voluntary. So the parents give the consent whether they want the child's data to be analyzed. And we still get around 96%. So you can see that this is something that our people want and use. They use it in many, many different ways. Also, when children have growth problems, they share this information with specialists, medical specialists. So last year we had 5 children whose parents turned to us, to help them analyze the data, especially for their children. And afterwards, the doctor's decision was not to put child on a hormonal therapy, because they saw that the parents' growth curve was the same as the child's growth curve. So the father was also the shortest, but then grew up to over 180 centimeters. So then we can compare children's and parents' data, and then also medical doctors can make easier decisions, because they say, okay, this is a normal development of this child. He doesn't need a hormonal therapy. So just one example.
Thank you. Other questions to Gregor? Please.
Thinking about the plenary session where we said, well, in education sectors, health, education is the core business, not necessarily health. And I was wondering if that is an argument, if you correlated, physical fitness in classes with the outcomes, and if that's possible and what that correlation would be, and if that's motivational too. Is it really the health argument and it's a good setting for this, or is there also an education?
We really don't. In physical education, we don't want to overemphasize health or obesity. We don't want to talk about it a lot, because our goal is to have children active, to play, as you said, to enjoy things, and not to burden them with those things. I mean, if they are active, they won't have those problems. But in children which do have problems, then of course you have to be sensitive about it and talk to them about it. So you say, okay, look, you probably notice that you cannot follow other children. No, do you want me to help you? And then you start the process of, individualized program, or a child co-creating this program. What do you like to do? So let's make a plan, So of course, this depends on teachers a lot. If you have involved teachers, they can do miracles. But sometimes you saw before that we have teacher shortage, that you have teacher burnout in schools because of all the administrative work, and not all the teachers are equally good, So sometimes you can see them really making a difference, and it can be done. But, also this crisis probably has to be addressed there.
Thank you. We'll take the last question. There will be chances for more interaction with Gregor, but he is speaking until his death, I'm sure, and we won't allow him. So we'll move on to the next presentation after this final question. Thank you.
Just a short question. Could you tell us a bit more about the results in girls?
Results in?
In girls.
In girls. Yeah, Slovenia, girls are really emancipated in Slovenian sports. So before COVID, the girls were on the highest level of physical fitness ever. So the girls were much more fitter than the mothers. And the boys were barely catching up to fathers, but the girls really skyrocketed. Now after COVID, girls have a little harder time recovering, but this is because the closure of school hit them more than boys. Because the physical activity in schools is even more important for girls than for boys, because more boys also train sports outside of schools. The difference is not huge, but it does make a difference. Yeah.
Laura, for a quick question, since you have the...
Well, yeah, I mean, even if you look at the PISA study, you know, we can see when I took the analysis of the same children that were in PISA study and their physical fitness, I could predict what their scores would be in PISA. So it's when the fitness goes up, their academic achievement goes up. When the fitness goes down, academic achievement goes down. It's all related to brain functioning. So physical activity is the cure for many things, which we don't understand yet.
And I appreciate, Gregor, that you're not saying physical education. It's positive that there's more physical education lessons in Slovenia, but obviously this is about transportation to school, active lessons, not just physical education lessons, and active breaks indeed. So we want to look at the whole spectrum here. So
everything helps, but at the end of the day, it's high intensity physical activity that makes the most difference. So everything around it is fine, helps, you know, but we have to be aware that we won't turn the story around only by walking to school. Yeah.
Thank you. Thank you very much, Gregor. Let's give her a round of applause. Gregor will be back with a vengeance. In the meantime, let's hear from Peter De Franceschi, who's from ICLEI. And now we are actually moving into the nutrition sector, a global network of cities focused on sustainability. And you will talk about the nutrition side of things, especially with a starting point in a project on indeed healthy and whole school approaches to nutrition. So looking forward.
Children catching up with their parents. I think usually the parents are much unfitter than the children. So I was impressed by Slovenia must be really in the Olympics. But anyway, I think that is really what we are sometimes lacking also in the field of school meals and food education, that though it makes sense to say, okay, a healthy school meal and food education has all these positive impacts. It's really impressive when you have this evidence and showing, you know, like you're fitter, the school results go up, or what you do in Slovenia in order to link it to policies. Because often here in Brussels, when I talk to Commission people, they say, show us the evidence, and often there is no evidence, or it's in the state in some studies. But it's also true that in a project that is 4 years long, you cannot extract so much evidence. But I think there, I hope we can work much closer together. Well, nowadays, especially for children, it's not easy, but also for adults to understand what is really healthy food. And especially from a procurement perspective, what is healthy food, how to define it, how to verify it is very difficult. Also, it's not just about, we talk about a lot of local food, though in procurement it's a bit more delicate because you should not discriminate, and in EU, and you cannot just ask for local food, but it's all interconnected. And what we do I run the global food program of ICLEI, which is called City Food. And we have a Triple H approach. And indeed, health is everywhere. So on one hand, we focus on healthy people and typically on behavioral change, food procurement, school meals, but then also healthy landscapes like food environments, because that's tough for a mayor. How do you create healthy food environments, especially in food deserts, or when you have per child an option of 43 fried chicken, but not a fruit shop, you know. And then healthy climate, how to link food and climate, which finally at the last climate conference is now finally linked. And what we try to focus is really on something where we see the impact, not just, you know, from session to session promoting sustainable food systems. We really want to see, and it's also working with cities, the mayor come and say, this is our issue. So we work with fresh food markets on one hand, which is about bringing the fresh food in, which is probably the healthiest if it's then used, and also for educational purpose. Then the whole circular food systems and school meals in particular, because there, if you do a tender and you ask certain criteria on health, on, I don't know, what other criteria you can ask, organic, that it comes from small farmers, fresh, seasonal, that food lands then on the plate, so it's very concrete. And climate is more about food waste reduction or plant-based. But what started our project that I want to tell you about today a bit is School Food for Change. Sometimes I'm confused with Schools for Health, but we go in the same direction. We work together, which is good. So what's triggered it a bit was this table that you see here, seeing, especially as an Italian, you know, we are very proud about our Mediterranean diet. But when you see that we are almost first place in child obesity, and also the way, especially Mediterranean countries, you know, you would be surprised. And I don't know, there is no research that I found that most of the schools where school meals are provided is in the north, like typically Finland has since the 40s, free school meals and food education in all schools. But I couldn't really see a relationship between child obesity, growing child obesity in the Mediterranean and in the Nordics, if there was any relation, you know, about countries who provide school meals and food education and others. But anyway, what we did then, there was a good call in Horizon, and we proposed the School Food for Change, and were successful. It's now the largest project on school meals and education and on procurement, and it's on 3 legs. On one hand, we look at tenders, so food procurement, and all the cities that are involved, and regions and departments. It's in 12 EU member states. They all have to commit, and when they have to do a tender, then they include this criteria that we develop, and they have to include minimum standards, which rank from healthy to sustainable to social to different ideas. And that's the one. The second is a whole school food approach, and I will tell you more about that. And the third is about the menus and the chefs, because you need the ones that also cook on your side. This just to give you an overview about the countries. It's in 12 countries, and it's, well, all major cities involved, some advanced, some less. And indeed, I always tend to take a plate with me with the SDGs, the Sustainable Development Goals on it, because if you do it right on one school plate, you can link it to all the Sustainable Development Goals, from education to health to small-scale farmers to healthy soils to, you name it, to water. And the whole school food approach, it's basically about 4 parts. On one hand, it's policy and leadership. That's really about the participation of all stakeholders. So typically it's schools that develop an action plan or a plan, or communicate, you know, with between the school principal, the chef, the teachers. So in order to set up a strategy, and because it must be participatory, it must be owned by all. Otherwise, if it's top down, or it doesn't really work. But it's also between the school and the city. And that's also something that I experienced, that schools, it's a very complex. It's not that the cities are responsible for schools. In some countries, it's the school that has all the power. In many countries, it's the national government. In some countries, it's the city. So it's not always easy to understand who decides about health and food in schools. The second is about food and sustainability. That's really a lot about the food, the taste, and that's important, you know, that the children, so some schools have, for instance, tasting competitions. I think it's in Flanders, right, that you also had, no, it's in Tallinn, they did even water tasting, which is quite interesting. And I know in Austria you have water schools even about tap water. And but it's also about a safe space, you know, where children can eat in peace, have their break. And it's part of education, and it's part of health. Then education learning, that we also address today, right? Really always push to combine healthy school meals with food education. So learning what is healthy food, cooking ideally, So in Vienna, for instance, they also don't have schools anymore at school, but they bring the kitchen to the school. They invested in, I think they spent around 80,000. So it's a little truck, and they open it like a theater, and there's the school, and then the children together cook, I don't know, burgers, plant-based burgers. And the challenge is to make them better than at McDonald's, and apparently it works. I tasted them themselves. So it's always about fun as well, right? But it's really about all this educational aspect, and also visiting farms. And finally, the fourth area is the community and partnership, because we have a huge ambition. We want to impact on 600,000 children and 3,000 schools, but then impact on 2 million Europeans. And how do we do that? Because the children, it's the parents, it's the grandparents, it's the farmers, it's the suppliers, and we want to involve them all. And so we see schools is actually can be catalyst for this food system change. We also have a petition for healthy school meal and food education in every school for every child. And we have quite some signatures, but we really want to push. And I think that was the challenge, that often the education does not necessarily talk to the health sector, and the health sector does not talk to the food sector. And also in the Commission, the different departments, when I tell to the education sector, are you working with the farm to fork, in the DG Agriculture, DG Sante, they sometimes don't work, and vice versa, instead of seeing this, really addressing this as a cross-cutting issue. And although there is this EU child guarantee, which clearly recommends at the council level to go for school meals. So I think this should be the minimum standard. So not just health promoting schools, but health, food, education promoting schools that comes together. Then we have really all the benefits and have a win-win-win. And that's the end. Thank you.
Thank you very much. Perfect. So while I said it's not two sides of the same coin, physical activity on the one side and nutrition on the other, this was another perspective. This was the nutrition perspective. So I'd love to hear if there's any immediate questions to the presentation. Yes, please.
Thank you for the presentation. I just have a question about the food quality. So does any of the partners that we saw on the network in any countries, how do they test the quality of food? I mean, what is the criteria? Is it was the pesticides used or packed in plastic or something? Is the criteria also on that level? Because when we're looking at children's development, we also observe that, for example, they're starting to mature earlier. So in Slovenia, we can see the boys enter puberty a year and a half earlier than 20 years ago, and the girls 1 year earlier than 20 years ago. So this has to do something with nutrition. I just want to see what is the criteria for quality food.
Yeah, that's actually a tricky question because, well, there are criteria like in some cities, they have up to 90, actually up to 100% organic food. In French, it's even 100% organic, 100% local. But in France, you also have a lot of food production and so on. In other cities, it's maybe 10%. And in some city, the quality is important, and they do tasting with the children. In others, I remember in Tallinn, a food caterer told me that the children complained it was too healthy. That can also be a problem. In Italy, I hear, and we talked about it in the break, that although sometimes the good food is provided, and I think that's the worst, if you have organic food and it's delicious and all, but the children, for reasons that they cannot explain, eat just half of it. And that's currently something that we hear, and it's not clear why. In Italy, they think during COVID, what happened is that the rules were very strict. Everything had to be in plastic. And some think that the children lost a bit. When it's plastic, they felt like, it's again plastic and the taste like this. There's no longer these connections, from the plate to the land, where the food comes from. So it seems like an industrial, boring stuff. So many eat just the bread all the time, or pasta, white without. But in principle, yeah, quality, that's somehow quality. But for the rest, as we discussed also, it's also difficult to define healthy food. You know, so the qualities lie somewhere in between, apart than all the safety regulation and so on.
Thank you. One more question, if we have any. You may.
And then thanks to all of you, because I think, Jakob, your comments at the start really set us off in terms of, you know, we tend to think there's so much only nutrition and physical activity. And here through through both presentations, but also yours, you see how important a holistic approach is, and getting the mayors involved because they have that holistic view in the countries that it does work. And I think to you, it's also this link to the sustainability agenda, and indeed how, you know, whatever you label things, health and sustainability, what is healthy? But we know, you know, we need to change in some direction. And I think the fun comment is so important, you know, and like, where does that come in? But also if you want kids and everyone to engage, but fun, even, you know, school authorities aren't thinking fun, they're thinking academic results, and it's a competitive world out there. But that's not what we respond to, all of us. So how do you bring that in? So it's just very rich, but how do you bring it together? But I think a specific question was in terms of, the food. If you're focusing on it, can you bring in, I'm thinking of the school fruit and vegetable scheme, the milk scheme, that for a long time it's a scheme, but they didn't bring in kind of whether you call it health promotion or an educational component. And around this program, do you link, is it really around the sustainability, or when you change school food systems, is there just, do you bring together some sort of component around, well, whether it's sustainability or education or learning? Is that up to the schools to do that, or is it very much just have fun and develop new habits by just presenting this, making it available to kids? I don't know if that makes sense. I just know, like, the school, one of the critiques that I think is being addressed, but still not systematically around the EU school milk, school and vegetable scheme, is that it came with no kind of educational side. So it's great that it's all there, but you can use that as an entry point to kind of shift things too. And I was just wondering with the if there are other components to teach children and youth about sustainability, or if that is a focus, and if there's
I think the EU school scheme, so basically it's also part, because that's also why we started in the EU Farm to Fork strategy, which after all was the first time that the Commission came up with a sustainable food policy. There are two interesting things. On one hand, one objective was the development of sustainable food procurement criteria. So what can be minimum standards, mandatory ones. And there we proposed also a manifesto. And the second one is the revision of the EU school scheme, which is basically run by DG Agriculture, so the agriculture department. And it's about fruits, vegetables, milk, but also food education. The only problem is the objective was to revise it, but already there was little in the pot, so 250 million. And then I said, okay, how do you revise it? Will there be more money and all? And the answer was, because of Brexit, there's even less, because 30 million less. So you have to currently, and then we lobbied obviously also the members of the European Parliament to push for more money, because in principle every school and country can ask for money for fruits, vegetables, milk, but also for food education in schools through that pot. But it's a small pot, but we definitely link it. Although it has to be seen, school scheme is more about the breakfast or a snack in between. It's not really about the actual school meal, which is more about the catering.
Thank you very much. Perfect. Laura, please.
Hi, my name is Laura. I also work with ISKA. I wanted to brag about Estonia because I'm Estonian, and we talked about this holistic approach of physical activity and nutrition. And since of this school year, Estonia has a new curriculum of physical activity. So it's actually called movement education, but it has the aspects of health literacy. So it covers this educational aspect of teaching about nutrition, but also mental health and the balance between the physical and mental well-being. So I think that's a very good example of when they're trying to incorporate health literacy as an educational aspect also into the school curriculum. So this is on the national level for the first time in Estonia. I don't think they're measuring a lot, Gregor, so maybe they should talk to you about it, on how the difference are going as well. We're not there with data measurement. Yeah, I will send the context, but my question was actually about school food. What about the countries who don't offer food in school for students? How do you work with countries where there is a warm meal, like Estonia? Every Estonian student has access to warm meal, and then the countries where they don't have that and the parents give the school package. How is that distribution in Estonia, and how do you work with these two very different settings?
Yeah, indeed. For instance, Netherlands, Norway, they typically hold on to their sandwich, but it's also in many other countries. It's sometimes, because that's our first objective, right? To get food to schools, because it's about social justice. It's about increased food prices. So we think that's important, that in order to grow, to concentrate, you need food, because if there's not really a proper lunch, or you till lunch haven't eaten, I mean, that's really tough. So I think that is where it starts. And then we can see how healthy and organic and all these other. But while we try to work with cities. Some cities want to pilot. Also, for instance, in the Netherlands now, there are cities who started because of social issues, because more parents have difficulties to buy proper food for the children. We also had as a replication city, Oslo. And there it's interesting that they even had free meatless meals and started the whole initiative in many schools. But then for political reason, they cut it, because the national government is center left and the local is center right. And they said, the school meals, and it was all closed and the people reallocated. So it's interesting how things change. Although my experience is, when we talk about children, health, and so on, food education, that usually are topics that resonate, and there's no political color, it's all supportive. But the wish and what we push for is really to have a school meal and food education in every school, because we think it's such a powerful tool. But it's also, I think, a cultural thing. In Norway, where I was recently in Oslo, they explained me it's just so in the culture that you make the sandwich, and someone told me, then you go with your son and you eat your sandwich, and you go in the woods and you chop, and that's how we are, Peter. I was told, so I said, okay, I respect that.
I have to say that if I didn't have to make those sandwiches every day myself, I would be very glad. But I'm from the same kind of Denmark, same kind of culture, so I appreciate that we don't chop so much wood, maybe as in Norway. But I'm the one doing the sandwiches at home here. All right, thank you very much. Let's give a final round of applause for Peter. Thank you. Please do stay. However, I would invite also Gregor to stand up, and maybe Ingrid as well, because we need to make sure we don't fall too much asleep. You've been very good students. I don't see many phones out, and I'm paying attention. So now I ask you to help me co-create a little bit of energy in the room. First of all, I ask you all to stand up. And secondly, I'm going to lead the way by showing a signature move. And after that, I will give the floor to one of you. So you better start thinking about what your signature move is. Let's make it something about stretching and moving a little bit, whatever you like. Maybe I can get some help to follow up to me. So my signature move, at least for today, is something that is also important for children, also in sports, namely the sense of winning. So we're going to do the winning pose and stretch and stand on our toes and stretch as much as we can and lean the head back. Are you ready to look like a winner? Good. Next signature move. I know that you have to think a little bit more, so I'm going to give the floor to Laura. She doesn't know this, but she can find out something.
I think I can do it without the mic as well. Okay, I'll use this. We're going to do a very simple thing that we're going to close our eyes. You need to close your eyes, trust me on it. And you're going to breathe the biggest breath you've breathed today. Just breathe in, inhale, and exhale. That was mine. I'm giving to Ingrid.
I'm not used to this. This is a new one. I think I'll go for the reach for the sky. Floor. And then
So we need somebody from the audience here. We need signature moves from different countries. Whatever you can come up with, please.
Okay, I will go for the hips. So we go around and around. Okay.
Good one. I like it. Both ways, indeed. More. This side of the room. Yes, please.
Yeah, just to, we had a lot of information, so maybe our head feels a little bit heavy. So to stretch the neck. You can stop, thank you.
Thank you. Big round of applause to yourselves and to the energetic people that took the floor. Good, you may stand.
Anybody feels worse than before after this exercise?
Does anybody feel worse? Is anybody smiling right now? I think so. Thank you very much. Be standing, be seated as you feel free as you want. But we're going into the next part now, which is where you get a chance to give input both to the speakers, but also to us at the project level. Give us any kind of reflection you might have taken away from today that you want to do differently, or give us any kind of recommendation that you think we should do more of. Something that sparked your interest or got you to thinking that something needs to change. Something we can understand that people are actually thinking about what it is we want to do differently tomorrow or the day after. This is the input that we're looking for, and it can be reflective on what you've heard from Gregor and Peter. It could also be something from earlier today. We are taking notes. We're very curious to hear what your views are, what you might have taken away, what your suggestions would be, because we're going to collect this as part of the project and make sure we try to take it forward as well.
Yeah, hello.
I love it. Everybody's still standing. Keep standing. It's wonderful.
Is it on? Yeah, okay. My name is Ellen. I'm from the Oral Health Institute in Flanders. And it's actually something we in Flanders are already doing a little bit, is that it's a lot divided. I hear a lot about nutrition, mental health, physical health, and I know there's a lot of progress to be made, but those three are really important factors that the school knows it's important to acknowledge and to act on. But I think for you three, it's also important to acknowledge the a little bit lesser teams or subjects, and to not only go, okay, we're going with the food program, we're going to with a physical activity program, we're going to a mental health program, but to think about how can we mix or how can we combine the programs, not for us, because it will be more work for us, but especially for the schools, to receive a whole package that they can act with, instead of a lot of different things where they have to choose and what do I need to choose and what is better and who makes the best, who has the best marketing or so on, but that the student actually, because that's our end goal, is a whole package of whole help. I think that's something I sometimes miss still in like things like today.
Wonderful. Thank you for that feedback. Indeed, Lois was saying it's not that we don't have enough tools. We give all kinds of tools. In fact, they might give too many. So how to think about things holistically. And I think oral health is also an example of something where we need to think about how do you make sure things are sustained. And this is where I'm not sure we are perfectly in shape in terms of oral health, but at least in terms of brushing your teeth. That's something that's been ingrained into children that they're supposed to brush their teeth at least twice a day. And so can we make things habitual? Can we make them just regular? That's where you get the win, at least in physical activity. So that's also something to think about. What are the ways that we can make things somehow just an ordinary routine instead of something that they have to do now and not tomorrow, or something that's special, right? So further input and reflections. Yes.
The reflection on what you just said, we had some team building, and it was because people were saying we want innovative people and we want innovative people, but then the guy leading the team building said we are successful if we have successful routines. So just.
Indeed, there's a lot of people that know a lot about how you create habits, how do you maintain habits, and how do you make yourself indeed a winner, and make sure you think about yourself as a healthy person, because if you do that, you will be more likely to actually have healthy habits as well. Gregor, please.
I'm just happy we talked also about teachers, because very often we forget about them. And what I see is that they are under a lot of pressure, and also schools are under a lot of pressure. So the whole society wants the schools to do something for them, So a lot of things the parents used to do before is up to schools now, So this burden on teachers is getting bigger and bigger and bigger. And I'm happy that we started talking about this, you know, because we all have a problem, the lackage of teachers, you know, and it is the most serious problem I'm seeing. And I'm not worrying about many things, but I do worry about this, that we will simply run out of teachers because the whole thing will become so unattractive. So we have to always put them into equation.
And that makes me think that it could look like it's only semantics, but I think it was also said today that we should not talk about these different approaches to health, including physical activity, including nutrition, as something that's an add-on, something extra to do, but rather an add-in. It should be incorporated in the way we think and work, including teachers, but obviously trying to compete with math and English and other things. It's sort of futile, right? You need to find out what are the spaces where we can incorporate these methods on a day-to-day basis. And my perspective is also that in leisure time, there's much to be gained, not only in physical activity and grassroots sports, but other ways that we can get communities to work together instead of putting everything on the schools and imagining, my opinion, that we just regulate and tell them they must teach health and it will all happen. Let's think about all the settings where human beings are and when they are able to make healthy choices indeed. Yes, another comment here.
I want to talk more about what you two said. I was a teacher for 15 years, so I left school because it was too hard, too heavy. And I made a choice to work here on the bottom and on the top to reach and hope to reach what you two say. I think it's a problem of having new teachers. We teach them in universities how to become a teacher. There has to be something done on that in that space, but also in the schools where you have the old generation who has their own ideas, the old ideas, and they have to make too the paradigm shift. We talked about it, and that is the most challenging thing, I think, that's bringing together those two groups. And that was what I saw in the last school where I worked. Young people came there and the old generation looked at them like, now you're going to say what we have to do and what about us? So I think that's the most difficult, and that's what I take home.
Thank you very much. We have time for more comments and reflections. Please.
We're talking about routines, and just to bring in I think of my daughter who uses Duolingo, and every day she has to get on it because she loses her streak, and the importance of gamification and rewards and applications in that sense, both for physical activity and nutrition.
Definitely. And sometimes screens might be helpful. Sometimes they may not be. And I think, Gregor, also, I think that was in your data as well, but others, certainly from different parts of the world, have shown that part of the physical activity or inactivity pandemic, I should say, is very closely correlated with the onset of screens. So I fully agree. We are not going to be able to imagine a world where screens don't exist or where we ban them, but let's make sure we understand when to use them, when not to, and for what. I think so. Great points. Yes, please.
A few projects and presentations today have touched upon not being able to quite reach every school, every region, every country from the WHO presentation. And it's like 50, 60, 70%, 96% in some cases. But I guess my question, my reflection is, how do you then reach the people who are unreachable, who are probably the areas or the schools who would benefit most from interventions and tools like these? How do you resolve that issue if it's recurring over years and decades?
Maybe, Peter, you want to reflect here, because the cities that you work with all over the world, they have wealthy neighborhoods and they have less well-off neighborhoods, and they have a lot of areas where it's really problematic to make a difference. So what does that look like on a city level? What do you do to reach the most vulnerable children?
Yeah, therefore, we do the school meals program is one of the impacts, for instance, of this school food for change is that most impact is indeed in vulnerable, deprived neighborhoods, because there the main objective is to get food to children. But beyond that, it's difficult to have data to show the impact. But that's a general challenge of cities and mayors. If you have a city or district where there are food deserts in the sense that there's just fast food and junk food and so on, how to change that as a mayor. Although in some, for instance, in Italy, the mayor is by constitution responsible for health. But then when you see ambitious mayor who change a lot, I see that how often they get from all sides, the higher governmental level problems and blockages to not go ahead, whether it's then reducing the traffic, to 30 kilometers per hour or reducing pesticides or on food. Also in terms of nutrition, for instance, it's there's not much that can be done. For instance, now in Germany, there was a city who said that in terms of food supply, shops, they're not allowed. Single-use plastic is no longer allowed. Then they got sued by McDonald's. Then it went up to the highest court. Now the city won, but it showed how difficult it is to say, okay, I would like to, because ideally a mayor wants that everywhere in the city there is an easy access to good food. But that's we are not there yet, and it's a big problem in the States, particularly with cities that we work. And then it comes in also like racism, depending on the neighborhoods, you see the food that is provided, and there are lots of other issues as well coming. So equitable food systems, that's a big issue. Also in terms of food security and resilience.
Thank you. We're getting towards the end here, so final 1 or 2 comments, and then we wrap it up.
Just to underline, I think it's such an important question that you just asked, because we do, as we said, school settings are settings where you can reach all children, but then you need the resources to do so, and they're often, and you don't see this. I think the technical term proportionally universal approach is a nice theory, but certainly not a reality. And I think in Schools for Health, that's one of the areas we would like to focus on without knowing the answers. I think in some of the plans, I think in Belgium, it was the RRF funds are going to giving teachers extra support when they can't, when they're struggling with children. And I really liked the comment in the plenary from the woman from the Parents Association who was saying that that was such an eye-opener. You invent mental health problems, so you get the extra support. Well, all you need is the extra support. You don't need the mental health problems. It's just, these kids just need support, and that should go to these schools. So again, not the answers, but we'll keep looking for them, and hopefully collectively.
Thank you. Any final reflection, takeaway, or suggestion for us to look at? If that's not the case, then thank you for standing for this whole session. I could even lean here a little bit. I would like you to give yourself a round of applause, and not least to our 2 wonderful speakers. And I have given them, or prepared a little bit of a gift for them, namely Iska's own movement pills. This is also a way of thinking about what one other presenter said, namely we need to think about how do we communicate. And I don't think that movement pills are for children, but the whole idea is that we think about prevention more than cure. And we also think about what is it that we put in our mouths, and sometimes think that there's an easy way to a difficult problem. Maybe there isn't, but hopefully with a movement pill, you can get well along your way. Thank you to you for paying attention and contributing, and thank you to the speakers.
And welcome also to our participants online. I hope that they are still with us today. So my name is Caroline Kostongs, and I'm the director of EuroHealthNet. Unfortunately, I wasn't able to be here this morning with you because I was chairing another conference of the Belgian presidency, and it was about mental health at work. And actually quite important, it's about how we can address the psychosocial risk factors in the workplace, which is, of course, also very important if we think of teachers. It's also about how can we include teachers that have mental health issues in the workplace or back in the workplace after they've had a difficult time and able to recover. You may be interested to know that the European Commission is thinking of developing an EU directive on the management of psychosocial risks at work. And I think that would be really a way forward to at least address this aspect, which I know it's a small, or not a small, but one of the aspects of the whole of school approach. But nevertheless, a crucial aspect, because without healthy and happy teachers, then it would be rather difficult for everyone, I think, to make also happy and healthy children. Yes, so I'm very happy to moderate the session together with Gabriela, and we do a co-moderation together. And the session that we look into now will be on cross-sectoral working. So how can we work with other sectors, with other stakeholders for a healthy school? And we will have several presentations. And we have asked the various speakers to also give maybe some opportunities or some leads for all of us here to work together, better together in the future. So I hope this session is also going to be a bit more forward looking. We will start with a pre-recorded message, actually, from Chris Wright. He is from the Youth Sport Trust in the UK, and he will talk about the Well School movement. You may be familiar with that. It sounds really, really nice. It's all about a movement where health and well-being of people is as important as educational achievements. It's also about creating a culture in the school where everyone can reach his or her potential. So very nice. And let's see what he has to say. Can we start the message, the video message?
Many thanks for inviting me to present on the Well School movement here in the UK and the work that we've been undertaking for the past 3 years. My name is Chris Wright. I'm Head of Health and Wellbeing at a children's charity called the Youth Sport Trust, based here in Loughborough in England. Well Schools was launched as a movement back in December 2013 with the ambition to create the happiest and healthiest schools in the world, building on the consistent feedback and data and insight that we get from PISA and from a number of localized research and insight reports based on the health, happiness, and future life chances of children here in the UK. Well Schools is built on 3 very distinct problems that are manifesting themselves in education, but we are seeing right the way across society. The first is that we are losing staff year after year due to the high accountability stakes system that we have here and a very narrow focus on a small range of subjects, and the stresses and strains that go with staff having to adhere to those accountability measures and the gradings of things like Ofsted. We need to ensure that every school in this country is well led, that we support staff with their health well-being and it's part of a whole school culture, and that we support our staff to be the best versions of themselves, because without that we can't have happy, healthy children. Our central pillar is well prepared. We've seen the most rapid decline in children's physical and mental health since 2010. And in more recent times, we're seeing ourselves facing a mental health pandemic right the way across the UK. Physical inactivity is at an all-time high, and we have consistently failed to move the dial on the Chief Medical Officer's guidelines of 60 active minutes on average every day throughout the week for 5 to 18-year-olds, which still stands at 47%. Inactivity, poor physical health, and poor mental health is leading to a rise in non-communicable diseases. And off the back of the pandemic, and now through a cost of living crisis, we're seeing children in our education system who are unregulated emotionally and have poor experiences, both of going to school and their future life chances. Our third and I think most interesting pillar is well equipped. We currently have an education system with a very narrow curriculum based on a very narrow set of knowledge and skills, mainly around maths, English, and the sciences. We need to develop an education system which values, develops, and embeds children's life skills, those skills that make them uniquely human in a digital age, and those skills that they need for a future in employment, but also in a modern society which is moving at a rapid pace. We also have growing inequalities here in the UK, with 1 million children who are in destitution families. These are families who have literally nothing. We have a further 3 million families who are living below the poverty line. The gap between those children living in our most affluent communities and those in our poorest communities is widening, where we see the evidence to suggest that we can improve the physical, social, and mental health and well-being of children, young people in this country, and improve those learning behaviours that we want for them when they enter school. We are actually seeing a reality that is a decrease in those domains, and therefore a widening in the gap of children's progress, their achievement in school, and the opportunities that gives them when they go out into the adult world. But we believe that there is a different way of looking at this. Wells Schools not only sits at the heart of our education strategy as a charity, where we're looking to reposition the place of physical health in our education system and the value of things like PE, sport and play, but also seeing this as a way to reimagine what our education experience might look like for children going forwards. Our call to action here is, how are you truly collaborating on a whole school approach to well-being and inclusion? How do we ensure that we are taking the best parts of what we can offer in education and through external communities and agency support to ensure that all of our staff are well led, all of our children are well prepared and equipped for the life that they want to lead, but that we create a culture in our education system that is led and managed by forward-thinking, dynamic and courageous senior leaders, that really values the inclusion and diversity of our school communities, and really knows where it's going with regards to engaging staff and pupils in decision making and creating those positive relationships and a sense of belonging when children are in school. Finally, we know that if we get this right, that it works. These are two statements taken from an impact report conducted by the University of Manchester and was reported and released last year with a suite of case studies which you'll be able to find on our website. If we get this right in the Wells schools that we've been working with, we've seen that there's huge amounts of autonomy over staff wellbeing, and schools can lead to positive outcomes by recognising staff, allowing staff to be the best versions of themselves and making sure that they're keeping them safe, well and supported. We know that in our case study schools that they've reported that their pupils are happier and healthier, and we're now seeing that permeate its way across the whole education system as a result of huge impacts on engagement with learning and making sure that children feel valued, listened to and responsive. There's a couple of websites there for you to follow the progress of the Wells School movement and also over social media accounts. On the website, you'll find case studies, resources, podcasts, all of the information relating to our partners who are supporting this collaborative approach, as well as the key guidance and principles of a Wells School that you are free to register for and download freely at your will. I hope you found that introduction useful. Please do come back to me if you have any further questions or opportunities to present to a wider audience.
We really find the Well School movement a really positive example of how whole school approaches can be put into action. And what really stands out is his message around creating positive relationships across the school community and making sure that children and staff feel valued. And this nicely links with our next presentation because, of course, meaningful participation is key. So it is my pleasure to introduce our next speaker, Dr. Ali Dunhill, who is the Director of Policy, Advocacy and Communications at Eurochild. The floor is yours, Ali.
Good afternoon, everyone. So I had three questions to answer today, and you'll find the topic of the questions on the top of the three slides. So first of all, I want to talk about what is meaningful participation of pupils and students. And it really needs to be described. I think we need to set the scene about what it is. It's not something that you can get right every time. It's something that many of us who have been working with and for children for decades are continually updating. We're always learning about how to do it better the next time to improve the experience for children. So at Eurochild, meaningful participation means effective, sustainable, and relevant discussions with children. Children are experts in their own lives, and this is essential so that they participate in every decision that is going to be made about them. Such child participation improves the quality of decision making and contributes to children's holistic development. It is also the foundation for healthy democracies and responsible citizenship. Our child participation strategy was developed in collaboration with children. Therefore, the first step I would recommend to you when developing a health promoting school approaches and policy is to do this with children. But rather than starting the conversation, as we've often heard today, with the what and the how, start with the why. Children don't know what you're talking about. Language is not always clear. The terms that we use as adults within these spheres of topics is not the language that children use. So describe this to children in child-friendly language. If you involve children in health promoting policies in schools, these can have several benefits. Same one, sorry. Here are some of the reasons why it's important. Introducing health promoting policies at a young age helps in educating children about the importance of a healthy lifestyle by instilling good habits early on. Children are more likely to carry on these habits into adulthood, promoting lifelong well-being. Involving children in decision-making processes related to health policies gives them a sense of ownership and empowerment. When children feel that their opinions matter and that their opinions are being considered in shaping their own school environments, they are more likely to actively participate and adhere to the policies. It also encourages collaboration between students, teachers, parents, and the broader community around a school, creating a shared responsibility for the health and well-being of the school community. Health promoting policies contribute to the overall social and emotional development of children. By creating a supportive and healthy school environment, children can experience better mental health, reduce stress levels, and improved interpersonal relationships. They can also contribute to the prevention of various health issues among children, such as obesity, diabetes, and mental health disorders. Prevention strategies implemented during childhood can have the long-lasting effects on overall public health. A healthy and supportive school environment can positively impact educational outcomes. We've heard this often today. Healthy children are more likely to attend school regularly, concentrate better in class, and reach their full potential. Good nutrition and physical activity also contribute to cognitive development. In summary, involve children. Involve children in the development of the health promoting policies, not only to address their immediate well-being, but also to set the stage for a healthier and more informed individual in the future. Next slide, please. So I'm going to talk about the EU policies now, but I want to start with not a policy, but a Eurochild report. So children's health and well-being are rooted in social and environmental determinants. The children who are most vulnerable to health inequality and poor well-being are those living in poverty and social exclusion. I would like to start by providing some quotes from children. In the Eurochild Poverty Takes Away the Right to Childhood report, you will find the results of conversations with children from Malta, Bulgaria, Croatia, and Estonia on child poverty. We wanted to understand how children view poverty, and we wanted to hear their opinions. And we wanted to know, what do they think we should do to make things better? Here you can see two quotes. The first one is a child from Malta: make healthcare free. This is a child that understands that healthcare is not free and it costs money. If that child is living in a family who's living in poverty, they are less likely to ask for support for healthcare from their family, as in, I need to go to the dentist. So we need to consider basically the impact of when there are costs for healthcare. A common theme throughout this part of the discussion with children was about the lasting impact of their overall development and mental health. A child from Bulgaria believes that bullying, a key factor in poor mental health of children, can be stopped in education. So children also realise the power of education. As Eurochild, we have not worked on the youth guarantee, but we have worked on the child guarantee. And as many of you may know, this is a council recommendation that gained full support from all members on the 14th of June 2021. And this clearly acknowledges that health promotion programmes are not available to all children. But under the healthcare section, the recommendation is with a view to guarantee for children in need effective and free access to quality healthcare. So member states are recommended to create accessible healthcare promotion and disease prevention programmes in targeting children in need and their families, as well as the professionals working with children. So I want to now talk about the mental health strategy from July 2023. And here you can see the quote directly from the mental health strategy that relates to mental health for children and wellbeing. So the Commission launched this call in 2023 for member states and stakeholders to submit best practices on children's mental health. This was in regards to health promotion, prevention, and early detection. And member states were asked to submit these via the EU Best Practice portal, which was actually described this morning. And the overall goal of this portal is actually to provide all member states with a resource. But none of these EU policy agendas and instruments will secure conditions for health equality and well-being in childhood and adolescence and support their participation in health promoting processes unless there is cross-sectional collaboration and cooperation. And this needs to be multidisciplinary. It needs to be intersectional. It needs to be in partnership, and it needs to be through alliances. And that includes with all stakeholders. Next slide, please. So no one sector can do this alone. We need investment in children, investment in health promotion. It cannot just be left to schools. Here you can see a quote from the current project. This is from the Schools for Health project, and it's very clear about what the whole aim of this project is. But I'd like us to consider not all children attend school. We need to ensure that children are attending school to be able to get this support. So I just want to give you some data. On average, 9.7% of children in the EU leave school early. Albania, 22% of Roma children between 10 and 18 have never been to school. In Greece, only 32% of Roma children are enrolled in preschool. There is also a distinction for Roma girls. They are pulled out of the school system much sooner than their male counterparts. And in Spain, the early school leaving is around 13.9%. So, as mentioned earlier, the Commission are developing an EU best practice portal on mental health promotion, prevention, and early detection and early intervention. The criteria for this is intersectional collaboration for the platform to assess the ability of the practice to foster collaboration. And this collaboration should be between the health sector, the social sector, and the education sector. All should be involved in health promotion. Therefore, my recommendation is to develop an intersectional collaboration and to share good and promising practices, but also share what didn't work. We often learn from our mistakes much more than we learn from our wins. Thank you.
Thanks a lot, Ali, and we would greatly accept your invitation to work together indeed much more. And thanks also for bringing up the EU Child Guarantee, that every member state is working on an action plan, and it is one entry channel, I would say, into national policymaking around multidisciplinary work for child well-being. So thanks for bringing that up. Right, let's now move to spatial planning and urban planning and to see how we can make the environment around school healthier. And I'm delighted to introduce to you Stephanie van der Vijveren. I got to know Stephanie in a personal case where indeed in my village we have a McDonald's who wanted to settle itself in front of 4 schools. And I am part of the local action group trying to fight them out. Which is not easy. And actually today, the province will decide on the legal case. We got involved with a lawyer to make sure that they are not settling in our community. But so let's see, maybe at the end of the day, I know what the result is going to be. But just, and then I hand over to you. One of my big concerns was that health was not part of the decision-making process at all. Health is not legally embedded and there's no legal tool indeed in the local level for authorities to refuse fast food on the basis of health and well-being of children. But Stephanie knows all about this. You're the expert, I would say. So please, I'm looking forward to your presentation.
Yeah, thanks very much for the invitation. So my expertise is mostly on nutrition and nutrition policy. I'll also keep to 2 slides as requested. So the question was, what's the evidence? What do we know on what works and what doesn't? What policy approaches are needed? And of course, how can we also bring cross-sectoral collaboration to move ahead in this space? So next slide, please. In terms of the evidence on nutrition in schools, there are actually quite some nice systematic reviews doing a summary. Some of those have been also translated into policy briefs. So this is a nice one from WHO as part of the STOP project. But generally, what do we know is that when it comes to interventions or policies in schools, what works is mostly focusing really on the environment, so the food environment, specifically increasing availability of vegetables, providing healthy school meals, of course, presenting them in an attractive way, and then also acting on removing sugary drinks and vending machines, for example. But then an important part as well of the evidence is that one of the big barriers for actually making a success of these interventions in schools, focusing on the food environment and also sustaining them over time, is actually the environment around the schools. Because in many cases we see that we are really dealing with obesogenic environments. I'll present some data from Flanders in the next slide. And so this is an important part to also act upon, even if it's not the lowest hanging fruit. But literature shows that this is a big barrier to really make progress on healthy eating among children. So next slide, please. So we did a comprehensive study in Flanders looking at environments around all of the schools. And indeed, we saw that environments are obesogenic, and over a period of more than 10 years, there was almost 25% increase in fast food and convenience compared to previously for basic schools as well as secondary schools. Yeah, next. Yeah. Yeah, and also in addition to that, it's not only the outlets, but also the marketing is a big problem in the outdoor environment, with more than 70% of the ads really for ultra-processed foods or alcohol, for example. And so this is an important area to act upon. Of course, this is not necessarily always a responsibility of the health ministers. So really, there needs to be collaboration with urban planning, zoning, public transport. But there are some good examples from abroad. For example, in London, there was a ban on junk food advertising brought in by the Major in 2019. And already there's been some studies showing an impact of that on food purchases. So that could be a good one. When it comes to the fast food and convenience outlets, that's a little bit harder. But the Netherlands has really published a nice report a couple of weeks ago on how this could be done tussen mens en ruimte. So they are looking at giving more power to cities and municipalities to be able to deal with these kind of problems and also be able to use health as an argument, for example, to avoid a McDonald's being placed in the middle of or around 4 schools, for example. So I think that there are some learnings that could be done. We should also work more with local governments. Even here in Belgium, there is a lot of appetite for these kind of actions, but for the moment they do not have the power or the legal tools for it. So when we think about cross-sector, it's not only health, but also urban planning, public transport, but there's also a need to work across governments. Like in Belgium, of course, we have the federal level, the regional governments, but there's also local government. And I think we should give more power to local governments through developing these legal tools so that they can also act on these obesogenic environments around schools in particular, but also in other places. So thank you.
Thanks, Stephanie, for really setting out the impact of the environment and the surrounding environments of schools and making that link to having an environment which promotes healthier eating. And in fact, this is also an action area that EuroHealthNet is working on, as Caroline mentioned. And it also sheds light on the importance of cross-sectoral collaboration and collaboration with sectors such as the agriculture sector. And we see more and more the mention of the EU school scheme for fruits, vegetables, and milk. That could be a potential entry point to making sure that we do create these healthier food environments. So without further ado, I'd like to introduce our next speaker to this panel. It's Carlos Martin Ovio, who is the Deputy Head of Unit from the Directorate General for Agriculture and Rural Development from the European Commission. Carlos, the floor is yours.
Thank you very much. My pleasure being here this afternoon. In a few minutes, I will try to share with you just in a nutshell a few figures about the EU school fruit, vegetables and milk scheme. What is the impact? There were some questions about what the impact has it been in the last years, and what is expected evolution of this. So a bit to center the topic, I wonder if the audience knows what the EU school scheme is about. So may I ask you to raise your hands if you have ever heard about the EU school fruit, vegetable and milk? Wow. 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 Then I think we can scroll the first. No. Good to know. So yeah. In case you were not completely honest by raising the hand, just as a summary, the school scheme is a program financed by the EU, by which we distribute fruit, vegetables, milk, and certain milk products to children, together with some accompanying educational measures. The scheme has been in place already for 6 school years. Now we're in the 7th school year, as it is today, but before. So it's the result of merging 2 previous schemes, one for fruit and vegetables, which was in place in 2009, and a very old one for milk, which has been already in place since 1977. So it's quite a big tradition in the EU for this scheme. The 2 main goals of this scheme the main one is to increase the consumption of certain agricultural products, not any kind of products, those who are perceived to be good from a nutritional point of view for children, and also to improve the healthy eating habits of children. The first part of my presentation was expected to be on the impact. Analyzing the impact of something a scheme like this is intrinsically difficult, because on the one hand, it's difficult to measure or to quantify the consumption of fruit and vegetables and this type of products by children, we can maybe quantify how much is distributed to them, but how much is consumed, and to what extent that is affecting their own consumption at home, and even more difficult, how it will affect the habits when these children will become adults, which is the long-term objective. This is, as you can imagine, extremely difficult to assess, and also to assess the educational aspect, the shaping of healthy eating habits. It's also difficult to quantify. If it was not enough, also during this 6-year period that I referred to, just in the middle, we had the shock of the COVID pandemic with the closure of schools, distance learning, home schooling, etc., which prevented distribution, etc. So from an evaluation point of view, it's been very difficult to get to quantitative indicators. I just put on the screen a few figures of the execution of the last school scheme. No, go back, please. I'm still there. Just figures that I think that somehow speak by themselves. In the last school year, we had around 80 million pupils participating in the scheme, which according to the age range would be, we could say that 1 every 3-4 kids in the EU has been participating in the scheme. In my view, it's relatively good outreach. The budget is 211 million euros. It's not used in full, but at the same time, member states put national money. So all in all, last year, around 290 million euros were mobilized for the scheme. Among the priority products which are to be distributed, which are fresh fruit and vegetables and drinking milk, about 60 million kilograms of fruit and 120 million liters of milk were distributed to children during the year. And other products which are not ranked at the same level in the nutritional profile, such as juices or some more processed fruit and vegetables, 7 million kilograms or liters, and also some processed dairy products like yogurts and some white cheeses, 22 million kilograms. Last in this slide, the last element, the educational part. About 24 million kids participated in different educational actions in the different member states. Could be school gardens, school orchards, visit to farms, or dairy processing plants or fruit processing plants, cooking workshops and experiences tasting in the school, simple lectures and lessons from teachers, and quizzes, the bar on the right. So this is at the right scale. The bar on the right is quizzes and contests, which is the most frequent type of activity used in the scheme. The evaluation that we did looked or found a certain weaknesses or points that could be improved. I will spread you the details, and I will just go to the next slide and tell you what are the elements we are looking at to improve, because we are reviewing this scheme and we hope that we will come with a new proposal during this year. So we are looking on one hand to the beneficiaries. Should we narrow the target of kids, which now is quite wide? So we focus on the age range where really the potential is more evident, let's say between 6 to 12 years, something like that. So it's where we can really act on the behavior of kids. The aspect of sustainability is very important. We want to improve sustainability of the scheme by different means, improving the healthiness, if you want, for instance, by limiting the distribution of products which are not so healthy, or such those having more free sugars or fats, etc., which they still have a place, but definitely we should be careful about the amounts that are distributed. But also other parameters, for instance, the way these products have been produced with more environmentally respectful production methods, etc. So these are things, organic production. These are elements that we want to introduce in the catalog of products. We want to definitely reinforce the educational measures, the topics on sustainability, on healthy diets, etc. We want to improve the budget execution. This is very technical. Probably you are not so excited about that, but we want the money to be effectively used. We want to simplify and reduce the administrative burden because it's quite complicated sometimes for schools and for stakeholders to implement it. And last but not least, to improve the coordination about the different administrations and agents which are in charge, notably health authorities, agricultural authorities, environment, educational authorities. So these are the plans for the future. I stop here and I am ready to take questions later. Thank you very much.
Thanks a lot, Carlos. Indeed, after all the presentations, we have time for questions, so please keep your question in mind. Thanks for setting out the EU school scheme so well. I was interested to see that you're also going to improve on the sustainability part of the food. I do think that the concerns with the sustainability and the climate concerns is an extra probably incentive also to bring into the schools for children and to be aware of, okay, it's not only for health that we eat healthy and so on, but it's also for sustainability and for the climate. I think it's an extra motivation to work on well-being, to take those planetary considerations on board and to really demonstrate to children, you know, how you produce food in a sustainable way. So we would be keen to hear more about it. Well, let's now move to our next speaker, who is Chiara Piccolo. Yeah. She's head of she's head of European Affairs of the Learning for Wellbeing Foundation. And you are also a member of the Commission Expert Group on Wellbeing in Schools. And we're all keen to hear more about that expert group. So the floor is yours. And also about your approaches, of course.
Of course. I'm happy to be here in under both my hat as head of European Affairs of Learning for Wellbeing Foundation and also as expert. Can we go to the next slide? Because of course I would like to introduce a bit what we do as Learning for Wellbeing Foundation, and as already in the name of the foundation saying nomen omen, like the Latin used to say. The Learning for Wellbeing Foundation was set up in 2004 with a vision, putting the well-being of people at the heart of the society. And indeed, our definition is realizing own unique potential through physical, emotional, mental, and spiritual development in relation to self, others, and the environment. But oops, sorry, because I'm Italian, so I could shout even without the microphone, but and instead also in Napolitan, so even more. So, but what do we mean as well-being? The Learning for Wellbeing approach is based on the living system perspective, using nature as its underlying model. And the Learning for Wellbeing approach is based on a living system perspective. And every living system is a wellness of physical hand, emotional heart, mental head, and spiritual, the spirit. And in the middle, this is why I showed Learning for Wellbeing ontological framework, there is what we call unique potential that we could call as self, that we could call as a soul. And actually, the mental, emotional, and physical are qualities, while the spiritual is more in dimension. And don't be scared. I'm not talking about religions. The spiritual dimension is different. Religions is just one way this dimension in some people could express, but I don't know if it happened to you when you are in front of an amazing landscape. It's happened to me, for instance, when I'm in front of the sea and I feel something, I can perceive something. This is what the spiritual dimension is. It's feeling interconnected and connected with around, with the environment, with ourselves, with the others. So, all living systems are greater than the sum of their parts and can only be understood through all the patterns of the interaction that are occurring within the systems in response to both internal and external relationship.
In describing the learning for well-being approach, we focus on some basic understanding on about living systems and what we call in our framework the principle, such as wellness, purpose, diversity, relationship, participation, system, and feedback. I will come back with this later. So, as you can understand, that the well-being is not, it's much more than happiness. It's a dynamic process. I mean, I study philosophy. I love philosophy, so I always mention the word eudaimonia that Greek ancient Greeks used to describe the well-being. That is more than happiness. This is more than well-being. The translation of eudaimonia is good spirit. So we cultivate well-being by exploring our inner resources, knowing ourselves, enhancing relationship with the others, and encourage participation in all the environments. Next slide, please. But as I said, well-being is a process, it's a dynamic process. So we need to look at it as I was talking about the common aspect as human being, as the living system. But the living system live in another living system, that is the environments, that is the other. So the emphasis of patterns relate to a central feature for our approach, the relationship between own unique potential and the intrinsic patterns of functionings that we can call inner diversity. What is the inner diversity? Inner diversity refers to the fundamental patterns through which we perceive, we process information around, we create our relationship. In a way, it's the way how we elaborate information. It's the way how we feel. It's the way how our unique way of feel and thoughts. Actually, inner diversity is what make us us, what make me, what make me you, in your uniqueness. And to relate to ourselves, others, and the world, we need to understand our own patterns and processes, and as they unfold through our life. And this is what I'm going to explain, how this process come. You see, there is in the middle, the person, and then there are the expression and the influencing that are processed. So because we understand, we know ourselves through, also through the meeting with the others. I mean, when we are a child, we have taught that a child understands that is a child when he starts to understand that it's other from his or her mom. So the process, as we said, we are in common with qualities and the inner processing and the inner patterns and the inner diversity. But we board with some inner capacities, some innate capacities that we, in our framework, we listed in these 9 core capacities that are relaxing, meaning that be awake on, already 2 minutes. So I need to run. So relaxing, so be awake in full present in your state. So I hope that you are now relaxing, engaging, embodying, so using all the sense, observing, trying to go in detail, sensing, so it's using other than the 5 senses, reflecting, that is also revisiting all the information that you received, listening with full of you, with the wellness, inquiring, so always be curious, empathizing, that everybody know further, so engage with the others, and discerning part, link the dots. Saying that, how this relates, I'm running because I would like also to talk a few information about the expert. How does this framework encourage the co-create partnership with that place children, the well-being at the center? As we said, we need to consider children in the wellness as they are. So every children is a living system. By giving space and pay attention to the children's mental, emotional, physical, and spiritual development. Purpose. So children need support and reinforcement in the expression of their uniqueness. Diversity, every one of us is diverse to each other, so no one size fits for all. Relationship, as Aristotle say, we are social animals, so we need relations, and we cannot, and children may be not extracted from the web of the relationship, but always anchored in the quality of the relationship. Participation to create well-being for children, we must involve them in defining and taking action for well-being. The system to mobilize actors across generation and sectors and disciplines. And of course, feedback to encourage self-knowledge, self-direction, and self-determination. Children may be guided in self-reflection by providing them feedback and information. Sorry, just quickly for the next slide, please. The expert group, sorry, I took too much time, but what I say reflects also on the will that we are using for in our expert group. And here, I mean, my colleague, Oana, just saying that what is more or less the mandate, so to develop guidelines for a systemic and whole school approach and purpose of assessment, improvement toolkit, and recommendation for awareness and rising activities at EU and national level. As you can see, we put learners at the middle. And what I could say about this expert group, actually, it's what we have heard already all the day. Teacher well-being also come first, because we cannot ask to our children to experience well-being at school if teachers are not well. And also that we need to engage all the stakeholders around. We need to understand school as a part of the community, so engage with multi-sectoral and different stakeholders. And focus on academic achievement is not enough. We need well-being to boost this academic achievement, and we need to foster and advocate for positive mental health, meaning that we need to take care of our children's mental health. Thank you, and sorry to be too long, and I hope that.
Thank you so much, Chiara, for shedding this dimension of well-being as a process with children at the heart of this movement as well, and also for linking to the EC, to the European Commission expert group on well-being in schools. As Schools for Health, we're incredibly interested to learn more about the activities of the expert group, as we do see areas and scope for collaboration. And as we've been talking about collaboration all day, we would really want to put this into practice. So we really hope that we can touch base and see from the guidelines and the toolkits what we can really use to bring this movement of well-being and health promoting schools forward. So thank you so much, Chiara. And linking to health promoting schools, I would like to introduce the last speaker for our panel session today, Ms. Ivana Pavic-Sementin, who is the SHE Network Manager and is here today to talk to us about the opportunities around the SHE Network and this movement and this impetus around health promoting school approaches. The floor is yours, Ivana.
Hello to everyone. Thank you very much for the opportunity to participate in this important event. I will talk about SHE's, Schools for Health in Europe. As you already heard today, the SHE Network has a long tradition, and there are currently more than 40 countries from Europe and Central Asia represented by the national coordinator in the SHE Network. The SHE Network has a key role in the future development and implementation of the health promoting school concept in the European region. She has a very generous developed website. Here you can find which countries are involved and who are the national coordinators. You can also find important huge disparities in school health. So this idea of SHE, that it can primarily be based on strengthening human capacity is something that is very valuable. Since I took over as SHE manager in February 2023, as Annette Schulz changed her job and stepped down from this position of SHE manager, the SHE board has tried to find a permanent and sustainable solution for the new establishment of SHE. This work is still ongoing. However, we are planning the next meeting of SHE board even today, and then in few days online, and also SHE board plans to organize an online meeting of the SHE assembly in the next period. In my opinion, the special value of SHE documents and materials is that they were created by the cooperation of experts from different countries. I think that this is precisely the reason why all the materials and documents are very applicable in the daily life of schools and can be applied in different settings and different countries. Being the SHE coordinator in Croatia, I can say that every meeting of the Croatian SHE schools, I am pleasantly surprised how positively the schools react and easily accept the SHE concepts and values. Also, schools are very willing to be a twinning partner to a new school that is just joining the SHE network. This is particularly interesting to me because we should be aware of the fact that numerous projects are implemented in schools, and then schools are often saturated with different projects. It seems to me that the exchange of experience between countries in the school health promotion is the key addition value of the SHE network, on which further cooperation and communication between the countries, the SHE board and the SHE assembly should be based on. Thank you.
Thanks a lot, Ivana, for presenting the SHE network to us all. I mean, the SHE network is incredibly important for the Schools for Health project and for all the work that we do. It has a huge resources, expertise, a great network to work with, and it's important that we see how we can further strengthen and have a thriving SHE network in at least in, so let's say, 2 years' time. Right, so we have about 15 minutes, I would say, 10 minutes for some questions and comments from the floor. I would like to give the floor to you. Is there anyone who would want to, who has a specific question? We have 2 microphones here, and you can ask the questions, and then we see from the speakers who would want to respond. Yes. If you can also state your name again. And
thank you so much. I'm Orkan Okan, and I have a complex question, and I try to make it short, and it touches 3 of the 5 presentations that we have seen. So in the first 2 presentations, we have seen that evidence that addressing the food and social environment is very important, and that we need to address the policy context of food, right? And in the 3rd presentation, we have seen a European Commission program on healthy and agricultural food, how they are important and how we produce them and deliver them for school in order to provide healthy meals to children and adolescents. And I was thinking, so we are talking a lot about health promoting schools and intersectoral context and what we can do to change the structures. Wouldn't that mean, or wouldn't be a recommendation resulting from these 3 presentations, to have a government intervention to subsidize farmers? And you see all across Europe, you have the farmers protesting now, so they want something, and this could be something, for them to produce these healthy foods, vegetables, fruits. And on the other side, on the other hand, ensure the transport and delivery infrastructure, again, another structural component to bring this food to schools, and also at the same time implement the anti-fast food policy, what you are having here today, the decision, and I read about that in the newsletter, meaning that you need to bring together the agricultural ministry, the economic ministry, the education ministry, and the health ministry to work on that evidence that we know from different fields, all the things that you presented, and actually then you would have a real health promoting school intervention addressing the environment, the structures that you need for structural prevention and health promotion. It's just bring all the things together that you found out and try to advocate for it. So as I said, it's just a complex comment, no question, but just something I was thinking when seeing all these different presentations. Thank you so much.
Thanks a lot, Orkan. Orkan, I suggest we take a few comments from the floor, and then I give the floor to the speakers who would want to respond. Is there anyone else who would want to make a comment? Lars.
When the pandemic struck, most schools across Europe were closed because the physical buildings were not really fit for purpose. It was not a healthy environment to be in. One of the reasons is, of course, they're not physically designed very well. It would be interesting if someone would also think about the physical design of schools in this particular context, because it is a learning environment. Even the built environment is, of course, a factor in that. There are a few that, for instance, have looked at the physical design of school toilets, a factor that actually educates you a lot about your body, your interaction with others, and so on. But most schools across Europe are horrible when it comes to school toilets. And the same sort of applies to the wider elements on the hygienical facilities of a school. Yet we send our children away every day, well, literally or philosophically. And it's not necessarily a good environment. I was fascinated, and the reference Orkan made to farmers is a fascinating one. There's something called extensive farming these days, where you have, by physical distance, you create a safe environment for these animals, for them to not use antibiotics. They have experienced less disease, they thrive better. What if we use that for children? It's just a thought.
Okay, thank you, Lars. Anyone else who would want to make a comment or a question to one of the speakers? This is your last time. Final opportunity. Anything burning? No, you don't. I don't want you to go home and thinking, oh, damn it, I should have said this thing. So important. Hasn't been said today. No doubt. I mean, a lot has been discussed today. So I'm sure that a lot of great points have been made. Okay, then I would like to see if any one of the speakers want to respond to the two comments. So one comment is about the food environment, linking the transport, the farmers in the neighborhood, and whether that can be better, more sustainably organized. And another comment was around the physical design of schools, whether whether that has been thought through and whether that can be improved. Carlos.
Yeah, I wanted to react to the comment or the question about subsidies to farmers. And I was to think you are coming a bit late with your question, because this is what the CIP has been doing for the last 60 years. No, so the CIP is spending every year about 50 billion euros on subsidies to farmers. And it's true that in the origins, in the 60s, it was just to encourage production in a completely different context, but the policy has evolved, and now most of the subsidies are linked to very strict rules on the environment, animal welfare, etc., etc. When it comes to healthiness, that's a bit more tricky, because farmers produce agricultural products which are very close to food, but a tomato can be very healthy, but maybe not so much if you put it in a ketchup sauce. A glass of milk is very healthy and nutritious. Maybe not so much if you do an ice cream or a carrot, very good. Not so much if it's a carrot cake. So depending on the use of these products, but in principle, potentially all agricultural products are potentially healthy. Thank you.
Thank you. Anyone else from the speakers? Yes, please, Ali.
Sorry, I actually didn't talk about fruit or veg, but I'd like to comment on it. I think if we create a barrier to something for children like fast food, they're going to get it elsewhere. And just an example from the UK, when healthy schools was started in the late 1990s and 2000, schools started serving only healthy food. Parents were bringing fish and chips and burgers to the school gate to hand to their children. And there was also people having delivered food from older brothers and sisters. So it has to be replaced with something that's affordable, and you have to work with children to convince them why they should be eating healthy food and not just taking something away from them. So again, you'll find that discussing with children will give you ideas about how you can do that. And I think also in the accessible, inclusive environment, wearing a previous hat, I used to assess accessible and inclusive buildings, including schools. And I think it's very important that you actually consider all environments that individuals will need. So consider from learning disabilities to physical disabilities to people with autism who may have issues with smells, light, etc. And the toilet perspective, most toilets in older school buildings, that's where bullying happens. So I think, again, really create an environment that's safe and inclusive.
Sorry, no, I would just to add on this, safe, accessible and beautiful, because well-being also is stay in a place that motivate you to open yourself, to be welcomed, and to enhance your creative way of functioning. So I think that, and this is something that in the expert group we realized a lot to investment in the infrastructures.
Well, a big applaud to the speakers of this session. I think it's really set the tone for collaborative action and for the opportunities that lay ahead in collaborating with each other across sectors and seeing how best to move forward and to optimize the contribution of schools when it comes to better health and well-being. So thank you very much for your contributions.
Well, we are here now at the end of the day, quite a journey. I think lots have been discussed, no doubt. Looking from this afternoon, I'm sure the morning was even full, even more full with all the great contributions from all of you. I would like to give sort of 4 takeaway message. The first message is, and it was really said also by Chris, is the urgency. No, there are health inequalities among children. The statistics say that it doesn't go in the right direction in terms of food, physical activity, mental health in our youth. And the work that you are all doing here, that we do here, is more important than ever. And we are very happy that it is acknowledged by the European Commission. Someone told me that indeed this event at the EU level is one. I mean, it has been a long time before when the last one happened. I would myself even not know. So it's great that we can work together on this very, very important topic. Second, we are sort of moving away from health promotion in schools to a more systemic approach where health and well-being is at the core of everything, of the work of the teachers, the schools, but also the school surroundings. And also very much taking into account the socioeconomic determinants of health and the places where schools are based, so that we don't also increase inequalities between schools. It's a bit what Ivana mentioned. If some schools are better equipped, they may hop along with the well-being agenda and others sort of lag behind. So you really have to be very vigilant of that. Vigilant, that's the word. Then third is that we want to go beyond integrating health-related topics in the school curriculum. It's important, of course, but we also want to create the right conditions and to enable children, young people, teachers to be active, to eat healthily, to look after their well-being, and also developing their agency to act, for example, against the commercial determinants of health, like the fast food and so on, what we're talking about, and take topics forward like sustainability. Third, the final takeaway message is that it is indeed not only the responsibility of the schools and the teachers, by far not. It's rather that we would like to take away pressures from the schools. It's very much a job of policymakers from the local to the regional to the national and the EU level, public authorities and the broader community around schools to make sure that that this all happens and that schools can truly become a driving force for change. With also the participation of children, which was very well set out by Ellie. Through this initiative of Schools for Health, we will take forward all the important guidance that you gave us in our work. We are building a hub, a Schools for Health hub, that gathers all the relevant resources. We are producing policy briefs, toolkits, and we will have a final conference next year, 2025. So we really hope to see you all there at that event. And EuroHealthNet will continue to work at the European Union level, identifying opportunities to take these agendas forward, monitoring what's happening and informing you and everyone else that is interested in the Schools for Health project and the wider SHE network. And also the opportunities for collaboration, because I think collaboration was indeed one of the words I think important throughout the day. We need to work together in order to to move forward on the Healthy Schools agenda. So thanks a lot for your participation. I would very much like to also thank the Belgian presidency and in particular Minister Hilde Krivets, the Vice President of the Flanders government. You saw her video this morning. It's really great that we got the support from the Belgian presidency for this event, because that raised importance and also the visibility among the member states that this is an important topic at EU level. This is also important if you look at the after the European Union elections, because at the moment already the mandate letters of the different commissioners are being put together and will be further confirmed later in the year after elections. And we want the topic of Schools for Health and the need to improve health and well-being of children high on that agenda. So thanks to all the speakers from the Commission. We had DG Santé, DG EAC and the DG Agri here, which was great. And thanks to Hadea, of course, for the funding. Without that funding, we would not have this seminar. And thanks for the WHO. I look forward to the new child and adolescent strategy. And thanks also for the Spanish presidency, and we have some Spanish colleagues here. They really pushed the agenda for child obesity and food in schools, which was very much on the agenda as well. And thanks for all your contributions from the SHE network, the UNESCO chair, Iska, Euriga, Eurochild, Shanzano. It was great to hear from you. And last but not least, a big thanks to my colleagues at EuroHealthNet, Ingrid, Gabriela, David, Chris. It's great. You've put so much work into preparing for all this. And and thanks to all of you for your contributions and for being here with us today. And I hope to see you again next year at our next event. Thanks a lot and safe journey. And for our participants online, thanks for being here with us. We haven't been forgotten you. Yeah.